Are we ready, Kathy? No? Okay. I'd like to call this formal session of the Northern Michigan University Board of Trustees to order. First of all, we'll have the roll call by Kathy Andrew.
Here.
Trustee Hart.
Here.
Trustee Haveman.
Here.
Trustee Mahaney.
I'm here.
Trustee Mitchell.
Here.
Trustee Murray Brown.
Here.
Trustee Savoy.
Here.
Trustee Young.
Here.
All trustees are present and we have a quorum.
Before we talk about individual requests to address the board, I'd like to say that we welcome all of those who are viewing this on YouTube. We felt as a board that it was very important to provide everyone within the Northern Michigan University community, including the community of Marquette, the staff, the faculty, the students and their parents, as well as businesses, individuals within the city of Marquette and in the Upper Peninsula, the opportunity to see all of the tremendous efforts that have been done to really assure as safe a possible opening for Northern Michigan University when classes begin on August 17th. And I think that there's no better way to do that than to be totally transparent and to have an opportunity to show the community, the Northern Michigan University family, all that has taken place in an effort to make sure that that we are going to be opening using the best possible safety protocols in order to do the best possible job to make everyone within the NMU family and within the Northern Michigan University and Marquette community safe. So for those of you who are watching on YouTube, thank you very much for watching, and we hope that you develop an understanding today for all the great work that's been being done by President Erickson and the entire staff here at Northern Michigan University. With that, are there any individual requests to address the board?
There are none.
All right. Next item on the agenda is the approval of the formal recommendations. Is there a motion?
So moved.
Is there a second?
Second.
It's been moved and seconded. All those in favor say aye.
Aye.
Opposed say nay. The formal recommendations are passed. The next item on the agenda is the ratification of the AAUP contract.
I move that we approve the AAUP union contract.
Is there a second?
Second.
Discussion.
Yeah, Mr. Chairman, I would like to explain my no vote if I can for the record. My no vote has nothing to do with the negotiation team of Northern Michigan University, the faculty, nor the outcome. For the past 3 years, and I've been on the board now almost 3.5 years, I've asked to have the opportunity to review the contract since the contract is with the Board of Trustees and signed by the chairman to see it before it went to ratification. That process was not done. It was sent out without the board seeing it. And therefore, since my requests and assurances were not respected by the chairman and the president, I plan to vote no on this contract.
Is there further discussion?
Yes, Mr. Chairman, I too am going to vote no on this, and it has nothing to do with the negotiations, the results of the negotiation. When I was board chair, I made a commitment as well to follow a process, and I thought we had a clear understanding that that process would be followed to its final conclusion. And most important part of that process was for this board and these board members to see the terms being offered at the conclusion of these negotiations, excuse me, to the AAUP. And we didn't have that opportunity. And there were some items in particular that we were negotiating on that I personally had a very strong interest in their outcome. So for me, in my capacity as a trustee, I didn't feel I was able to fulfill my fiduciary obligation to the people of the state of Michigan and to the university and review the contract's final terms before it went to a vote. I, at the same time, want to thank the negotiating teams for both the AAUP and the university for the good faith negotiations and the outcome. My vote has nothing to do with the outcome of the contract, but rather, like Trustee Haveman, it has to do with the process. I think it's very, very important that this board have the opportunity to review the final terms of the contract before it goes to vote, and we weren't able to do that. Thank you.
Is there any other discussion on this contract ratification? The Chair would like to make a statement. I'll take full responsibility for that. It was presented to me, and we had those discussions, and I moved it forward. So I apologize to my distinguished board members for not having done that. That's not the problem of the president, but I take full responsibility as chair of the board. I want to congratulate Dale Capella, as well as all those who negotiated on the administration's part, as well as to congratulate those from the faculty for a really great, good faith effort on putting together an effective one-year contract. It was a difficult contract in that none of us had any idea we'd be facing this when those contract negotiations began. But I certainly appreciate all the work that was done by the faculty on this. I think that they worked very hard, and I know Dale and his team worked very hard. And I think the end result of this is a terrific one-year deal. We'll have the opportunity to negotiate it again next year, and I'm certain at that point that this will be brought back to the board prior to having that done. But again, I want to congratulate everybody on our side as well as on, and we're all on the same side, everybody from Northern Michigan University who did such an effective job of getting this contract passed. So having said that, we'll have a roll call vote on ratification of the AAUP contract.
Please indicate by saying aye or nay. Trustee Patante,
Aye.
trustee Hart,
Aye.
trustee Haveman,
No,
trustee Mahaney,
Nay.
trustee Mitchell,
Aye.
trustee Murray Brown,
Aye.
trustee Savoy,
Aye.
trustee Young.
yes,
A vote of 6-2.
Based on a 6-2, the ratification has occurred. The contract has been ratified. Next on our item, the next item on our agenda is the interim policy on relationship violence, sexual misconduct, and stalking.
Mr. Chairman, I'd like to move that the NMU Board of Trustees approve the interim relationship violence, sexual misconduct, and stalking policy.
Is there a second?
Support.
Discussion.
So just a couple of words on this. I think, as we all know, with the new Title IX regulations that are going into effect on August 14th, there's been a great amount of effort that's been put into reviewing our current policy. Within the policy that the ad hoc committee has spent time reviewing in conjunction with several of the staff members who have worked painstakingly to pour over 2,000 pages of information that's been put out to them. I feel like we've come up with a very streamlined, easily understood policy around sexual misconduct. I'd like to point out that we were also able to expand some of these protections that weren't originally afforded to events that may occur in association with NMU and also events that may occur off campus. So it was very important for us to ensure that we have the ultimate protections in place for victims or alleged victims.
Mr. Chairman, I'd just like to say that I think the process that this board decided to use an ad hoc committee to look at some of these specialized policies has really worked well. And we appreciate the president and Jessica and others' involvement in this and Alexa as the chair, but it's also a statement that is so complex, what the federal government came out with. And the document which you're acting on today is actually understandable and usable and operational. And I think it's going to mean a lot for the safety of this campus. So I just wanted to get that on the record.
Further discussion?
I also want to point out that there are procedures that will go along with the policy that will come about at another time too, that the administration will be responsible for, and that will even provide more information to the students so that it will be very understandable to them.
Fritz?
I'd certainly want to express my gratitude to Trustee Hart and to the entire committee of the board that did this. One of the most important duties of a board of trustees is to set policy. That's really the nature of a board for a public institution, and how the board of trustees approached this incredibly complex issue with a real commitment to making sure that we have the kind of policies that demonstrate our commitment to a safe campus environment could not be more important. So this is great work on the part of the subcommittee and the board for doing that. And you all deserve great recognition for that.
And who's on that committee with you, Alexis? Trustee Hart?
The ad hoc policy committee consists of Trustee Vice Chair Savoy and also Jim Haveman. In addition, I would like to give some special thanks as well to Janet Kosky, Mike Bath. There's countless individuals who put their time and energy into this policy, and I definitely want to make sure that those individuals are recognized.
Thank you very much. And as the chair, I would like to also congratulate all of you for a tremendous effort, for your leadership on this committee as well. Trustee Hart, I think this is an outstanding conclusion to this, and everyone is to be congratulated on the hard work that we've had. We'll take a roll call vote on this interim policy as well. Would you call the roll, please, Secretary Andrew?
Please indicate by yay or nay. Trustee Patante,
Yay.
Trustee Hart,
Yay.
Trustee Haveman,
Yay.
Trustee Mahaney, Trustee Mitchell,
Yay?
Trustee Murray Brown,
Yay.
Trustee Savoy,
Yay.
Trustee Young.
Yay.
It's a vote of 8-0.
Motion carries. The policy is adopted. The next item on the agenda is Indigenous Peoples Day. We had a committee assigned to do that. The committee was chaired by Trustee Savoy. It included Trustee Young, Trustee Hart, Trustee Murray Brown, and I was the ex officio. And did I forget anyone from that committee?
Nope, that's it.
And why don't you give a report on that and then make a motion, please?
Sure. We had several committee meetings. This committee included, in addition to the trustees who were named, also included students from the Native American Studies Association, the Native American Students Association, and also the NMU representative. We had a student who graduated, but who started on this effort toward Indigenous Peoples Day years ago and stuck with us beyond his graduation because it was real important to him to see this through. So we've had a number of students, we had faculty, we had Professor Marty Reinhardt was also a part of this committee. And we had some very lively discussions. We went through a lot of different questions regarding the scope of this, whether we had enough people involved in it. The request for this was that the second Monday in October be named Indigenous Peoples Day. And so as a result of the fact that this was coinciding with Columbus Day, we sought to have Italian Americans also involved. We did not get any Italian Americans coming forward despite our efforts. So we ended up with this group going through all of the different pieces of what was being requested by the students. The students also came up with some suggestions on what they would like the event to look like. So Trustee Hart, do you have a motion?
I do. Thank you. Mr. Chairman, I'd like to move that the Board of Trustees approve the university adding to the University University calendar and Indigenous Peoples Day recognition on the second Monday in October.
Discussion, is there a second?
Second.
It's been moved and seconded. Discussion.
Yes, I have a comment. I want-
Trustee Murray Brown.
my glasses on. I just wanted to say that I'm proud of the conversations I participated in with the board members and student leaders as a work group to discuss the request to honor the history of Indigenous peoples on the established federal holiday of Columbus Day. The proposed activities discussed with student leaders is balanced and is rooted in creating a knowledge opportunity. It holds the truth of the revered historical account of the discovery of America and addresses the series of events surrounding that same history that has contributed to the generational trauma, psychologically and emotionally held by Indigenous peoples still today. I am exceptionally proud of our board and student leadership who chose not to think of this as a moment in time, yet a profound learning opportunity for the campus and community. The plan that was proposed is respectfully holds appreciation of contradictory truths about our American history. We chose to lean into boldness and accuracy, and doing so with respect and commitment to our collective commitment to inclusive community, where differences, including differences of opinion, are recognized as assets of our beloved institution. Thank you.
Is there further discussion on this issue?
Yeah, Mr. Chairman, I was watching some of the events with Congressman Lewis's death this week, and what really struck me was his continued theme of saying, if you see something that needs to be addressed, do something about it. And I think this issue's been around for a bit, and I think it's good that we're doing this.
Trustee Young.
Thank you, Mr. Chairman. I want to thank Tammy, for all your work on this, or Trustee Savoy, for all your work and the committee. I participated on the committee. I will not be supporting the motion, but also want to thank Jim or Trustee Haveman for actually being one of the motivating forces behind this, which started one of my first meetings when I came on the board. And I know this has been a big issue with Trustee Haveman, and I appreciate his efforts. One of the concerns that I have is in our core values, which we get every board meeting here. One of the core values we have is inclusion. And I think that adding this to the calendar, but not adding Columbus Day is exclusionary. And we are excluding a group of people or a day from our academic calendar, which is recognized by a lot of people. And I think that, the groups that are supporting this and have brought it to us to look at, talk about the need for inclusion. I think this is exclusionary, and because it does not include Columbus Day on the calendar. And so therefore I won't be supporting this motion.
Further discussion.
Mr. Chairman, if I may. First of all, I want to thank everyone that's been involved in this across the campus, not just these trustees that have been involved for their good work. There's been a lot of active, engaging conversation about this issue, probably since I joined this board 6 years ago. And let me start by saying that I am fully in support of an Indigenous Peoples Day. In fact, I'm in support of more than an Indigenous Peoples Day. I'm in support of an Indigenous Peoples Week. And I would like to see that week be a week of celebration, education, reflection on our Native American history, culture, heritage, and one that brings the people of this peninsula and this university especially together. As board chair, I pushed for such an event, and I worked closely with ASNMU towards that end, and we were very close to completing an agreement that would have brought that into effect. And before that, as a trustee, as many of us, older trustees, if you will, on this board, longer serving trustees on this board, we passed the first, I believe it was the first baccalaureate degree in Native American Studies in the nation here at this university, or at least the first degree for this university. Like Trustee Young has mentioned, I feel that placing this, this Indigenous Peoples Day on Columbus Day does not fit with our values. I don't think it's inclusive. In fact, I think it leads to division and divisiveness. And I also think I'd like to just take a moment here to reflect on and put some context into what Columbus Day is, at least in my view and in my life experience. I think it's important to understand the history behind this holiday because I think much of the media and the public has misstated it, frankly. And it is a holiday that has importance to the UP. When Italian American Catholics began to immigrate to this country, they were typically treated as second or third class citizens at best. Many businesses wouldn't hire them, landlords wouldn't house them. Anti-Italian and anti-Catholic sentiment in America was very strong. It culminated in the largest single lynching event in this nation's history in New Orleans, in fact, in 1891, when 11 Italian Americans were, a mob murdered 11 Italian Americans because they were Italian Americans. Not to diminish any other similar violence that went on in this country against other groups and ethnicities. Italian Americans struggled to be accepted in this country. The only jobs they could typically find were the worst ones, the jobs no one else wanted to do, such as underground mining here in the UP, that led to a significant Italian American population here in the UP that is still strong and vibrant. I'm not surprised, by the way, that you cannot find an Italian American that would come onto a university campus in America today and argue in support of Columbus Day. That's just not going to happen. So today, we have an Italian American population here in the Upper Peninsula that has contributed much to the region and much to this university and this community. It's against this backdrop of anti-Italian American Catholic sentiment in this country that Columbus Day became a national holiday in 1937 under the presidency of Franklin D. Roosevelt. It was a means to attempt to recognize the accomplishments of Italian Americans and Catholics in America and to help foster their acceptance and inclusion into this country. It had little to nothing to do with Christopher Columbus or his exploits. In my lifetime, I have yet to know anyone who celebrates the day as a means of celebrating Columbus himself or the exploits of Christopher Columbus. It's to celebrate Italian American heritage. One of the arguments that I've also heard around campus as to why we need to do this is because everyone else is doing it. I'm really not interested in what everyone else is doing. I don't accept the premise that we at Northern Michigan University must do something simply because it's what everyone else is doing. In my view, that's frankly an insult to our intelligence. We have greater intellectual capacity than that. Placing Indigenous Peoples Day on Columbus Day puts an asterisk next to it at best. It will always be viewed as an attempt to insult Italian Americans and Catholics, at least by me, and I think by many Italian Americans in the Upper Peninsula. It will not bring us together. It will potentially divide us. And sadly, it could potentially divide us at a time when we in this country more than ever need to embrace and cultivate our common binds. So, Mr. Chairman, I fully support not just an Indigenous Peoples Day, but an entire week of events celebrating our Native American heritage. However, I cannot support placing this event on a date that effectively causes divisiveness and leads to misunderstanding. I will vote no on this motion. Thank you.
Is there any other further discussion on this issue?
I would like to point out that we do have Native American Heritage Month in November, and that is a celebrated month. This is distinguished from that.
Any other comments? The chair would like to make a couple of comments in this as well. I'm a history teacher. I studied to be a history teacher. For 6 years of my life, I taught American history. I've been a student of American history my entire life. And one of the most troubling things I find as a history teacher is in today's world that we've come up with a term called cancel culture, that we try to place the values, the 21st century values on 15th century people or on 19th century people. When I watch Michigan State University saying that it may want to change James Madison School to a different name. When I see others criticize Thomas Jefferson, yes, they had slaves. Yes, in today's world, that's atrocious. In the world that they had then, it wasn't. James Madison is primarily the author of the American Constitution. Thomas Jefferson, the author effectively of the Declaration of Independence. They created this country. Christopher Columbus was a courageous guy looking for profits, got the Queen of Spain to fund his trip to the Indies, hence the term that was used for a long time, Indians, because they thought they might have reached India when in fact they hadn't. We all know that the Vikings were here 500 years before Christopher Columbus. He himself, by the Queen, had some of his titles taken away from him because of the atrocious behavior he had towards the natives in the Bahamas and elsewhere in the Caribbean that he had. But Christopher Columbus came to this new world, and as a result of it, we're all here today enjoying this unbelievable country, the greatest country in the history of the world. And I think in my mind that this attempt to put values on people who didn't understand the values of today is a huge mistake. And as an old history teacher, I am going to oppose this for the reasons cited by Trustee Young, the reasons cited by Trustee Mahaney. I find it very troubling. It's a very difficult decision. I thought it through, did more research on Columbus, and what kept coming back to me is the but. The colonialization, the colonization eventually of this new world to the Western Europeans was very, very important to the world. And it began because of Christopher Columbus. If you're an indigenous person, obviously this colonialization is something that you find abhorrent. But as I wrestled with it, and as I've wrestled with it for a long time, I still don't believe in cancel culture. I still believe in freedom of speech. I still believe in the fact that we can't impose the values of 21st century America on 15th century people, or on 19th century people, or even on 20th century people. If we did that, there would be a lot of people who would be who would have changed their opinions. When we talk about the LGBTQ community, Barack Obama was opposed to gay marriage when he first ran for president. He evolved. One has to feel that many of these other figures would have evolved had they been around in the 21st century, but they weren't. So I will also be voting no on this issue for the reasons I highlighted. So with that, if there are no other further comments, we'll take a roll call vote on the issue of Indigenous Peoples Day.
Please indicate by yay or nay. Trustee Patante,
Yay.
Trustee Hart,
Yes.
Trustee Haveman,
Yay.
Trustee Mahaney,
Nay.
Trustee Mitchell,
No.
Trustee Murray Brown,
Yes.
Trustee Savoy,
Yes.
Trustee Young.
Nay.
On a 5-3 vote, motion carries. Indigenous Peoples Day is adopted. And now we're going to get into the announcement of an informal session by President Erickson.
Yes, I'd like to announce an informal session to be held in conjunction with the September 24th, 25th, 2020 meeting of the board.
And now we're going to start discussing the COVID task force updates. Before President Erickson begins this, I want to say that after this is done, we're going to open this up to the public for comments. We ask those comments to be 3 minutes. Any questions you have, we will answer questions until all the questions have been asked, no matter how long that lasts. Northern Michigan University, as I indicated earlier in this meeting, has really done an extraordinary job in preparing the campus for the upcoming school year. And we as a board felt it was very important to take this information to discuss and to show you what steps have been taken. And we hope that you will be very favorably impressed as to what has been happening on this campus to position us to have as safe an opening as possible. So with that in mind, again, afterwards, we will take your comments and your questions, and I'll turn it over to President Erickson.
Thank you very much. As we started down the path of considering where we'd be this fall, we actually started the day after we went remote in March. This has been a long, comprehensive process. We have taken the approach that in order to do this safely and in order to be truly prepared, we needed to take a team approach. And we put some comprehensive protocols in place and used a team model that I think has put us in the position where, as I've looked around not only Michigan but around the country, I do not believe that there's any university that is better prepared to be able to move back as close to face-to-face campus, face-to-face instruction as we are at Northern. I begin by just giving enormous credit to Cindy Pavla and Mike Bath, who have been chairing our overall team with this. And I think you'll be very impressed at the kind of work that we have put in place. The level of detail is just absolutely extraordinary. I tried to keep track for a while of how many decisions each day we were making about what's going to happen in 2 weeks from now. And I didn't have that many fingers and toes. I mean, it's just been an absolute remarkable process. I'm really delighted to be able to share all of these today. Look forward to answering any questions you have and getting any feedback along the way. One of the tools that we've had that has really helped move us forward has been we were able to work directly with Colonel Dave Adams, who's been advising us on our strategy on how to open, to really looking at and reviewing our plans. And I thought it'd be a good place to start is to ask Colonel Adams to walk through the kinds of things that he has looked at, the kind of dashboards that we've been able to put in place. And then from that, we'll break down and look at each of the individual subgroups and talk about that. So to begin with, let's turn to our friend Colonel Dave Adams and ask him to speak on NMU's action plan and the issues that are related to that. Dave?
Thank you so much, Mr. President and Mr. Chairman and all of the board. Thanks once again for inviting me to join these important discussions. And also thank you very much for putting your trust in me to help contribute to your planning campaign. Next slide, Mike, please. I've been working with the staff at NMU since mid-May to safely reopen the campus in the fall. But to be honest, the planning had started well before that. Mike and Cindy had been monitoring the world situation back in February before the campus even closed in the springtime. From my planning and health background, I've been focusing fairly specifically on what were the key decisions that would need to be made to get the campus reopened, working with Mike and Cindy and their teams. I visited the campus twice, and I've been in ongoing dialogue with both Mike and Cindy on a weekly basis for the past 10 weeks. I have a really healthy appreciation for the amount of work and the dedication of effort that has gone on to this point and continues to get the campus open safely. We've reviewed existing guidance, federal, state, local, and as you know, that guidance has been shifting. It evolves even to this day. Just this week, the CDC put out some guidance on quarantine timelines that are just slightly more relaxed. So a plan is basically a flat document. It's only as good as the point in time when it's put together. And I submitted the draft plan just a few days ago as it stands at that time. And I'm happy to continue that planning effort and tweak the plan as need be. The team identified and they looked at all the actions that it would take to protect the people, the campus. I examined some of the parameters to consider to monitor how well we're doing. Not only is everything that we put in place working well, but what are some of the other indicators that would tell us that things are going in the wrong direction? Next slide, please. Of course, the priority is on the health and safety of all personnel, students, faculty, staff, visitors, the community. The construct of the plan is fairly straightforward. It's used commonly in some military models and elsewhere. Again, my background is 30 years in the Air Force as a medical officer in the Air Force Health Service, as well as 10 more years working with the Department of Homeland Security, doing some national level planning and federal planning for biological incidents. That's kind of the area I come from. So the plan itself is outlined fairly straightforwardly. Together with the team and I, using some of that previous experience that I brought to the table, we built the framework. It calls out guidance from leadership, and that guidance has been coming very straightforwardly, going back through April when the campus, March and April when the campus was closing, and in May when there was a decision made to reopen the campus. So we were really working on roller skates to make the campus ready as a result of that decision. Once the key actions were identified that needed to be undertaken to reopen the campus safely, I offered kind of an activity matrix to the 12 work groups that are supporting the emergency logistics team. And they've been working with that matrix to help identify what key actions are needed, what their dependencies were, what their timelines should be so that the campus could reopen in August. We also captured facts and planning assumptions. These are very common in most planning constructs. Facts, of course, are, as they state, things we know to be true. Assumptions are things that, lacking a true fact on the matter, we can make a cogent assumption that something is likely to occur. For instance, a simple for instance, we know as a fact that there is no current vaccine for COVID-19. A planning assumption is that there will not be one until at least the first of the year or the spring semester, as we might say, or I guess the winter semester in your case. That's a fairly valid assumption at this point. That may change over time. I know that there are many experts who are very optimistic that we're on a fast track on a vaccine, but again, that's just an example. I also helped, I suggested and helped build out an operational planning dashboard, which is similar to the matrix, but it just is more of a report card. It uses a red, yellow, green construct. And that dashboard is some 40 slides long that was populated by all the sub work groups to kind of send indicators of exactly where they thought they were for completing the key actions that were needed. And to the best of my knowledge, there are no red areas, at least not on any slide deck that I've been involved with. There remain a few yellow areas, and we can discuss those throughout the course of the afternoon. But I think by and large, we've come a long way from earlier versions of this dashboard. So with the actions to reopen underway, we also reviewed what are those key indicators that provide the situational awareness for the president and the executive council to undertake to better understand where we stand relevant to COVID-19 and what those indicators may provide data and information on for decision-making for the campus remaining open over the course of the semester or adjusting plans accordingly as the situation may dictate. Next slide, please. One of the key areas in the plan, of course, is on health monitoring and management. After all, it is a health crisis that we're in, a global pandemic. And key to the university, there's a number of them, but these keys I captured on the slide have to do with testing, health screening, making sure that we understand the baseline, the case baseline of all returning students, faculty, and staff, and that's initial testing. Episodic testing has to do with students, faculty, and staff who may become symptomatic and need to contact their healthcare provider, and in students' cases, the health center for follow-up advice, guidance, and treatment. And then surveillance testing, you'll hear more about, which is more of a snapshot population-based ongoing testing. The analogy it's kind of a loose analogy, but the analogy to that is what's going on now with some of the professional sports teams where they're doing surveillance testing of their population base all the time to see where they stand. And of course, coordination with both Marquette County Public Health for contact tracing, which is very important, for case reporting, which is it's required by state and federal guidelines, and also coordination with the Upper Peninsula Health System to understand what's going on in the community and to understand, to be blunt, what's available within the health system that NMU could tap into should students, faculty, or staff become so sick that they require hospitalization. Next slide, please. Another major area had to do with campus infrastructure. And Mike and Cindy and all the teams have done such a great job in identifying, evaluating where we stood in terms of what needed to happen to make the campus ready from a physical footprint. Evaluating and putting into place engineering controls. And by engineering controls, we talk a lot about physical barriers, signage, traffic flow, and so forth. Also looking at some administrative controls, and a lot of that had to do with academics in terms of scheduling of classes, scheduling classrooms with classes, and what changes needed to be made administratively to make the campus more safe. You'll hear much more on all of these shortly, but all physical spaces and programs were evaluated to identify and to minimize the risk, as was all the process reviews for all of the services that are provided on campus. Everything for from academics, which is based, that's the reason we exist, but also for all those supporting agencies, the housing, dining, how we would conduct athletic programs, how student activities could continue with the modifications needed in considering COVID restrictions. And then, of course, other campus events and programs, especially as they apply to not only the students, but also with the surrounding community. Next slide, Mike. Information sharing is key, and there's a strong communications program in place, and NMU was very proactive in reshaping a COVID webpage that provides the information, the educational tools needed so that all students, faculty, and staff, as they return to campus, they understand what to expect on the campus, what's changed from historic norms on campus operations, but also what is expected of them as they contribute to keeping themselves, each other, and the whole community safe. It really does involve a partnership among everybody involved. Next slide, Mike. Okay, in monitoring the status of operations, this is a very dynamic situation. I included in the plan, and working with Cindy, Mike, and all the team leads, what are the kinds of things that we could help inform by way of data sharing to Dr. Erickson and the Executive Council on things to be concerned about. And of course, some of the major ones include, what is the disease situation as it currently exists? What's going on at the Michigan level? What's going on regionally in the Upper Peninsula? What's happening in Marquette County? And what's happening on campus? Are cases growing, or are they shrinking, or are they staying the same? And we're just in a status quo with the number of cases we see. The UP, as you know, has been pretty fortunate in that the geographic isolation, while sometimes I guess some could consider it a curse, I think most consider it a blessing, especially in the case of COVID, in that the disease spread has been much less predominant than it has in more populated areas, certainly in Michigan and also around the whole country. I'm speaking to you from Southwest Florida, and we're watching things very closely down here as we're hitting some significant peaks. Testing and contact tracing capacity is important. As I mentioned a little earlier, do we have enough testing? Of course, we're doing 100% testing going in. We just have to keep a very close eye on the logistic streams for test kits. Dr. Fitzpatrick and his staff to understand that that their supply chains are robust enough that they continue testing. Contact tracing is an area that we don't directly control. That's managed by Marquette County Public Health. And we're certainly available to help contribute to that in some ways. And the staff has been looking at some of those options. But contact tracing is a fairly essential function, and it's not an easy function. It's very time consuming. It takes a lot of people, depending, of course, on your caseload. I mentioned the healthcare system capacity slightly before, but basically to know how many beds are available in the local community that could absorb NMU-related students, faculty, and staff should hospitalization be necessary, to include those that may require intensive care. I know Mike and others have been in dialogue with the health officials from the local systems to help determine how many respirator beds are really there, how many are staffed. One of my backgrounds, I'm a registered nurse in my associate and baccalaureate level programs. And I practiced clinically for a number of years in the Air Force before I got into what I guess most would traditionally call management. But to me, I always specify a staffed bed. It's not just a cot in a warehouse or a gurney in a hallway. It has to have, especially if someone is relatively sick, as COVID patients frequently become, close monitoring is important. And the nurses, technicians, and respiratory therapists have to be available. There needs to be enough trained to manage any number of beds. And I understand that the local healthcare system is actively working towards what their capacities are. I know Mike has been in dialogue with them. And so that's something worth tracking, because you'll certainly want to know that as they're approaching capacity, should that occur, that will certainly influence your operational decisions on campus. We've talked before about isolation and quarantine capacity. The teams have done a great job in identifying isolation capacity on the campus. But as the number of those students who are living in housing and their positive contacts require isolation and quarantine, monitoring of those numbers is going to be very essential as you start approaching any capacities, because you need the plan B will have to kick in, what that plan B may be. I know the president and team members at the university level have been looking at some plan Bs to capacity in isolation and quarantine. There's other indicators, absenteeism beyond what the normal expectations are for a healthy fall in the Upper Peninsula. The level of compliance among all personnel with the protocols that have been put in place and that are captured in the plan, those all become important. But again, the whole point to the monitoring the status is to make sure you understand, you have the situational awareness to make educated decisions on any changes needed to operations. Mike? Here's one that I don't mean for this to be an eye chart, and it certainly is, this is actual data, but it's certainly not meant to carry anybody's water for a decision today. But a trigger and threshold, and the example I'm using here is the number of positive cases in the state of Michigan. And this is as of 3 days ago. And one of the suggested thresholds is that there's a significant increase in the number of cases. And I'm considering here, for the purposes of discussion, a 30-day and a 5-day period to take a look. I know cases over the last 2 days have gone up significantly because there have been changes, kind of a catch up to the number of positive cases that are being reported. I believe what I saw this morning was that yesterday in the state, it was closer to 900. And as you can see, that would be the highest number on this whole chart. But again, a rolling average over 30 days and a rolling average over 5 days might help the decision makers take a look at saying, you know, guys, we're either on course or we're off course in terms of controlling this thing at the state level. And there's similar kinds of data slides on the regional level, the Marquette County level, the NMU level. We also have slides that match up to some of the key indicators in areas of testing results, testing capacity, isolation capacity, downtown hospital thresholds for the number of beds available, and then kind of an all others as defined category that would help the president and the executive team understand where we stand at any given time. That's all the comments I have for now. I don't want to belabor just the openers. I know there's a lot more information to follow, so I'll leave it at that. Thank you.
Thanks so much, Dave. Really appreciate the depth and quality of the work and guidance that you've provided. As we were planning for this board meeting, Chairman Mitchell asked for an update from all 11 of the emergency logistic planning work groups. So as we've been preparing those, we were also working on a special WNMU media meet as part of our set of activities to share what we are doing. We've been as aggressive as we can about getting the word out on the activities. We've had numbers of opportunities to do that. And then the fact that our friends at WNMU and Media Meet have been putting several things together. In fact, Elizabeth Peterson from WNMU, who by the way is leaving or has just left. In fact, this was one of her last projects, has prepared five video stories for this program. And once we saw them, we thought they're really perfect for us to share today. So what I'd like to do is give you a bit of a sneak peek of the upcoming Media Meet program that highlights several of the work groups. I think this will give you a really good flavor of all the things that have been going on, because it does give you an opportunity to see several different things. So Pat, if you can start that video, it's about 20 minutes, but well worth the time to look at.
Northern Michigan University is preparing for the return of over 7,000 students to campus this fall. Coronavirus will make that experience look very different. Nearly every aspect of the campus has been modified. Coming up, a special media meet with the co-directors of NMU's emergency response team. We take an up-close look at the different work groups on campus and the efforts being made to ensure a safe return for all next. And welcome to Media Meet. I'm your host, Elizabeth Peterson. It's been a summer like no other for administration, faculty, and staff at Northern Michigan University. Over the past few months, the start of the fall semester has been the priority. Today, plans are underway for a return to campus. But what does that look like? Certainly a very different picture from fall of 2019. We're talking to the various groups on campus that have been working so diligently to ensure a safe start, and we're doing that today with the co-directors of NMU's emergency response team, Mike Bath and Cindy Pavola. I want to thank you both for being here. This is a special program today, a little different format from our traditional show, but we wanted to really give an in-depth look at the efforts being made because, Mike, opening campus was a decision that wasn't made lightly. There's been a lot of work, a lot of things still going on to ensure a safe start. So to begin the program, talk to us about that and what's been happening the past couple of months.
So Elizabeth, we developed 11 logistics groups to put together to talk about the different facets of campus in order to return to campus, including our facilities, our safety, health matters, logistics with technology. Obviously, we're going to have our classes are going to be held differently than what we have in the past. And obviously, we had to make sure we had enough technology installed to make that happen. Working very closely with our academic group and trying to make sure that we're covering all the nuances. You know, it's one thing to say we're going to put a class of 18 in a room. Well, what do you do with the other 18 that might have been in that room too, because it's 36? And so we've been working very hard to modify the classrooms, modify our housing areas, dining, in order to make sure that we're doing it safely and meeting all the executive orders and CDC guidelines that have been put in place.
Sure. And so today we're going to be talking to the people that you just mentioned, those involved in the different work groups across campus. And we're going to start with testing. A decision was made early on to test all returning faculty, staff, and students. And the university is funding these tests, 8,500 of them. Cindy, why was this important?
So it was important for a number of reasons, Elizabeth. The first one is it allowed us to develop a baseline that we'll end up using throughout the year to monitor our COVID positive trends. Are they going up? Are they going down? And we wouldn't really know that accurately if we didn't know what we had coming in. So that was one of the reasons for doing the tests across the campus community. The other was that it will help us to quickly identify positive people who are asymptomatic, who don't know they have COVID, but are positive for the infection, that we can alert them and get them into quarantine protocol as quickly as possible. This is really important, within our residence halls and our campus apartments, but it's also important within our, employee groups where they're working on campus, they interact with the students. And then it's also important for our off-campus students because they're living in our community. So we thought we'd do one overall big test, and that's going to give us a lot of baseline information that we can use throughout the semester.
So, getting a COVID test, it can be a bit intimidating, but this particular test, it's less intrusive. And for those who have already taken it, the feedback is that it's not that bad. Our first story of the program is with Dr. Christopher Kirkpatrick and NMU student Joe Nardi. They allowed us to follow along as he was tested. Take a look.
All right, I'll take your ID here from you and I'll scan that if that's all right.
The test starts with a quick check-in, verifying information, talking through the process.
This is a shallow nasal swab, so it doesn't go all the way back.
In fact, with this test, it's so simple, patients like NMU senior Joseph Nardi are able to do the swab themselves.
It's not like what you see on social media where the swab is going pretty deep. This one is just about an inch, not even, so it's not painful, and it was really smooth, and I was pretty happy with the process.
Supervised by a doctor or nurse, the test requires just a few swirls of a nasal swab in each side of the nose, much less invasive than other tests. But Dr. Christopher Kirkpatrick at NMU's Valmetti Health Center says just as accurate.
Perfect, you are all set.
Awesome, thank you very much.
We found that this is as accurate. We're looking specifically at the molecular and the genetic material of the virus, so we're looking for active virus within the secretions of the nose.
Samples will still need to be sent off to a lab, so there is a brief waiting period, as with other tests. NMU is determined to test every faculty, staff, and student before the start of classes. The hope? To catch asymptomatic patients who may not be showing any signs of coronavirus.
We always will be trying to catch up with this virus. The ability of doing this testing and getting a quick response will allow us to intervene in the cases as soon as possible, and that's very important to control the spread.
Testing is just one piece of a complex puzzle of guidelines and restrictions. Dr. Kirkpatrick stresses the importance of everyone on campus monitoring their own behaviors.
The testing is a big component of keeping campus safe, but the more important things in my mind are actually the administrative controls that are in place, the mask wearing, the social distancing. All of those things are what's going to be controlling the spread of this virus. The testing is icing on the cake.
And I want to thank Dr. Kirkpatrick and Joe Nardi for allowing us to follow them through his testing. It was super helpful to see and understand exactly what will happen. And in talking with Dr. Kirkpatrick, he was excited to share that the health center has new equipment that will allow them, after the mass testing, so this fall, be able to do the testing in-house, so they won't have to send samples out, shortening that waiting period. And Cindy, that's certainly great news.
That is so important, and it's so exciting because last winter when we would have students or faculty and staff members who had to be tested, who may have had COVID, we weren't sure, they would be tested and the results often didn't come back for literally almost a week, and only to find out maybe they had a really bad cold. So being able to get test results within an hour or two so that we can know what the appropriate action to take is so exciting for us on campus. And we're really looking forward to the ability to be able to do that kind of testing right here on the Northern Michigan University campus.
And Dr. Kirkpatrick, he stressed the importance of everyone on campus wearing masks. Another initiative by the university was to supply every faculty, staff, and student with 2 NMU branded masks, which we have them right here. Very nice. And they also purchased 20,000 of these face masks. And on top of that, NMU purchased over 1,300 face shields to use in the healthcare programs and masks with clear fronts that will be used in some of the clinics around campus. Mike, talk to us a little bit about why you all decided to invest in these masks and the role that they play.
So the decision to purchase the masks and to distribute them to the faculty, staff, and students was to kind of get some consistency so that everyone had an opportunity to have the masks and have kind of a starting point. Obviously, there's other individuals that will want to wear their own mask, which is fine, but we felt that having a branded one would kind of put some unity to this whole, we're in this together, trying to make sure that, you know, we're all following the social distancing and wearing masks. And kind of putting our brand on it also.
Sure, absolutely. And you know, when we talk about all of this PPE, a big piece of that is storing it, ordering it, figuring out what is needed in each area, which includes plexiglass barriers. A lot of time was spent on this, as well as creating a plan to clean campus in a way that has never been done before. Here's a look at the cleaning, the PPE, and the ongoing effort to keep everything organized and stored. From plexiglass barriers in classrooms to masks and sanitizer stations, faculty, staff, and students will experience a new campus this fall. Changes designed with one thing in mind: safety. It starts with spraying every surface on campus using a new Clorox 360 machine.
The antimicrobial spray is basically a coating that does not leach into the skin. It's the best way to explain it is like Rain-X that you put on your windshield. So it creates a coating, and up to basically 2 years it kills any germs that come into contact with it.
The fine mist spray has been used in the healthcare industry for over 10 years. Combine that with a daily spray the university has been using for a couple of years, along with individual spray bottles for each department, and Sager says campus will be clean and his staff will be ready.
We're going to have a more visible presence, and we'll be out and about and trying to get as much as we can as far as touch points go.
On top of cleaning, the use of PPE and plexiglass barriers across campus will be the norm. Stocking up on supplies and keeping it all organized has been a summer-long project, but through a partnership with Kimberly-Clark, bulk ordering through Fisher Scientific, and a plan to recycle gloves, departments will have what they need.
We are currently getting those orders in. We are finding some things are back ordered, but we are being guaranteed we are going to take delivery of all these materials. As of right now, they're still on track to get here by August 1st.
The barriers have been designed and made by NMU's trades department. You'll see them in nearly every location. A different style for different needs, all being built, delivered, and placed with the hope of keeping everyone on both sides of the glass safe.
Trying to meet all those functional operations to ensure that things are fluid, efficient, but yet safety is #1 priority.
And Mike, this is another example of the investment being made into creating a safe campus. Certainly a huge part of the planning spreading across nearly every department. What has it been like trying to secure this amount of PPE, build what you can here in-house, and then trying to figure out what will work best?
We recognized early on that we weren't going to be the only ones needing to purchase PPE and create barriers. And so we started ordering materials and supplies a couple of months ago. And whenever we found the opportunity where we could buy large quantities, we placed orders, knowing that things are going to be different. Individuals that didn't necessarily use protective gloves in what they did would probably need to use them now. So we wanted to make sure we had enough to at least get this semester started, and then a continuing process of purchasing as we go forward. You know, individuals are going to be, they're not going to know exactly what they might need, so we want to make sure that we have the ability to fill those orders as they come through. Another big part of the project was identifying what spaces needed to look like in order to maintain social distancing, and those that we couldn't maintain the 6 feet, we would put barriers in. So we needed to do that relatively soon, so we knew what we had to build. As you saw on the video, we're building a lot of our barriers in-house, and replacing them around the classrooms here in the next couple of weeks. So when the faculty, staff, and students come back to campus, the rooms will be set up in a safe manner, following all the social distancing guidelines. And we visited every space on campus, including offices, conference rooms, departments, for example here, to determine what we would need to put in place to make it safe.
Sure. So we've covered testing, cleaning, securing and distributing PPE and other various materials. All of this works as long as everyone knows what to do with it. So then there is the communication piece, communication to faculty, to staff, to students, making sure that when classes resume, to the best of your ability, everyone is on the same page. And so the NMU Safe Campus Initiative was created. Cindy, explain what that entails.
So the Safe on Campus campaign is our collective messaging to all the different various groups that we work with on campus and off. As you mentioned, it's students, faculty, staff, it's parents, it's prospective students and parents, it's our community members, legislators, and alumni and retirees. And they all have different questions, but they all have a lot of the same questions as well. And the Safe on Campus campaign tries to answer the most prevalent questions we have on campus in easy to understand ways. And sometimes we've used a little bit of humor. You'll see some fun posters going out that you don't want to make fun of COVID, but you also want to sort of, get the students to relate to the situation, that it's not all dark and gloomy. If we take care of ourselves, we are in this together. Put your masks on, social distance, wash your hands frequently, try to help take care of people around you who have special needs. So that's the campaign, is really about taking care of each other. And by doing that, taking care of yourself, taking care of each other. And by doing that, we can have a safe campus. We can have a great college experience here at Northern Michigan University this fall semester, despite the COVID situation.
I couldn't believe how many different posters and signage and just different materials that communications had come and created together for this. It's pretty incredible, the undertaking, but let's take a look at how it all came together.
This fall, you'll see signage around campus pretty much everywhere. Signage indicating occupancy, reminding everyone to wear masks, how to travel in the halls, encouraging you to wash your hands. It will be in the bathrooms, the elevators, the halls, on the floors. You won't miss it.
Signage is going up. They're setting the classrooms, and so a classroom, say, that had a capacity of 40 is probably down to about 20. And so they're moving tables around, chairs, that type of thing. And there's signage for each one of those rooms.
It's a huge undertaking, creating not just campus-wide messaging, but working with each department to ensure their individual messages are also being communicated properly.
All the work that these work groups are doing, it's new. We've never done this before. And so, we're trying to be nimble. We're producing signage on the spot. We can change things and really get what people need to best communicate to faculty, staff, and students.
It's about reinforcing all of the messages and answering questions as they come in, whether that's via the website or by keeping faculty and staff informed. And at the core, it's remembering that we all are truly in this together.
We are doing, besides the instructional signs, we're going to do some campaign type signs, encouraging people to make good choices both on campus and off campus. When you have 8,000 people, we're a large population. And so we're going to try to encourage people to be courteous, be kind, do smart things, make good decisions.
And I think we can always use a little reminder about that. And there is so much information to relay this upcoming fall, communicating that properly through all of the different channels. Cindy, that is a huge undertaking.
Well, it's certainly been keeping us busy. And again, different groups have different questions that you need to take care of providing them. So we've all been working really hard and using as many different formats as we possibly can to reach the different groups and be able to provide the information that will help them as they prepare to come on campus. It really has been a huge undertaking, but our communications and marketing crew, and actually a lot of people across campus have been involved. They've done just a spectacular job, and we couldn't be more impressed with how they've turned around all that communications in such a short period of time.
And talk to us a little bit about the Passport app and what it was made for, how it was created, and how it's helping keep all the information together.
So our technology work group, when we were talking about having the big drug testing event, we were trying to figure out how would we coordinate all of this. And we have the most amazing technology people on campus. So as they were listening to us, they said, well, let's create, an app. And so we were like, okay, let's create an app. So they created the Passport app where you can sign in to, you'll sign up for a testing time. And then on this app, because the event isn't just a test, you're also picking up your student ID card, you're picking up your parking pass. If you have a vehicle on campus, you're picking up, if you live on campus, you're picking up your residence hall room key or your apartment key. It's also picking up your pre-ordered books at the bookstore, and of course the laptop, the notebook computer that Northern gives all of the students. And so students get a lot of stuff at the start of this semester. So we thought, well, let's all put it in one place and they can go through. So the Passport app kind of shows each student what they need to pick up. So not every student is getting a parking pass. Not every student lives on campus. They don't need a resident hall key, but this app shows them what their steps are so that they know how to go ahead and pick up all of this, all of these items. Additionally, most of these steps require some kind of a signed document, typically on a piece of paper with a pen. But because we didn't want to be sharing pens and getting too close to each other, the app allows you to get these documents and to sign right on your smartphone, or in some other methods if you have other technology. And so it's been just a really cool piece of, really a well-organized piece of technology for us to use for this big event that we have.
Yeah, and it makes the whole process so easy. Turning now to feeding students, this again is an area that will look very different. Dining operations on campus stayed open through the beginning of the pandemic, which allowed staff to figure out what worked and what didn't work, giving them a bit of an advantage this fall.
The dining halls are quiet now, but soon thousands of students will return and will be ready to eat. Here at the Northern Lights Dining Hall, pre-COVID capacity was around 800 people. This fall, it will be around 400.
We've really looked at what do we have to do from a health and safety standpoint, what are the restrictions and requirements from the CDC and the local health department, and really just tried to make sure that our interpretation of it is accurate and our systems that we put into place adhere to all those guidelines.
To start, the dining department designated a COVID response lead who has created protocols and procedures for each location and area. Northern Lights Dining will be exclusively takeout through move-in, and when the dining area opens back up, students will be assigned sections as they enter the facility, and of course, masks will be required when moving around.
A phased approach that begins a little more restrictive than we have to will allow us then to transition and enhance our level of service as opposed to take away from the level of service.
Keeping students and dining staff safe is the priority. Dining employs over 500 students at their various locations. Training and the flexibility to adapt as the situation changes are what keeps them moving forward.
I think in general, what we've put together is really a testament to the team that was here throughout the early part of the pandemic. Those team members that were here from March all the way through May, ensuring the safe service of food to our students and our guests.
And that has been a constant theme in talking with these groups on campus. Every person I spoke with stressed the team aspect and just how many people are involved in modifying and adjusting campus life. Mike, talk about that, the process of getting everyone involved.
So we have the 11 work groups, and there's probably about 75 individuals total on those groups. And then we've embedded individuals from multiple groups into groups to help work through some of these decisions that have to be made. And I mean, we could do a whole show just on thanking those individuals that have been part of all of the planning and the implementation of the plan. It's been a true team effort, and following not only our guidelines, what we've come up with, but also vetting it against the executive orders and the CDC guidelines to make sure that we're following the appropriate safe guidelines that have been put forth. And as we all know, the executive executive orders have changed from the beginning of the pandemic to now. And so there's a review process that has to happen when a new one comes out, a new executive order, to make sure that what we have in place still is applicable. You know, it's one of those that it's kind of a moving target. You know, a lot of people say, well, did you have a lot of plans in place for this type of an event? We had some, but we're writing the manual on this one. You know, it is going to be different, and when you come to campus, it is going to look different, and there's going to be some different messaging out there than what a normal opening in the fall type atmosphere is going to be. But we sure need everybody's help, and you know, students, faculty, staff, everybody needs to be, you know, cognizant of the social distancing, the mask wearing, and be patient, because we're going to find out that, you know, maybe this didn't quite go the way we wanted to, but we'll make it that way. You know, we'll figure it out, because, you know, we can sit down at a table and walk through all these different ideas, but we're going to need to be it's all going to be a team effort, you know, right from the students on up to the administration and everybody in between.
You know, we were just saying that a phrase that is repeated is that we're all in this together, but we really are. And that phrase, I think, will continue to be repeated for a long time. And you know, that dining experience, it is one of the favorites among students, that and their housing experience. Our last segment today looks at the efforts being made to protect that experience, yet ensure that it's done as safe as possible.
NMU Housing has been operating in some sense since the COVID pandemic started.
I think the best thing we've learned is how important our relationships are with students. So we work really hard, always have in housing, to build relationships with students, and we understand the value of that and what those relationships can accomplish when we're faced with adversity.
It's that mutual trust that got them through the pandemic and all of the changes. And Corpy is confident that this fall, even while there is a cloud of uncertainty among those returning, they'll be okay.
There's some anxiety. I think the best way we're trying to relieve that anxiety is through information and doing our best to provide accurate information, up-to-date information, and this whole thing has taught us about change.
Adapting to change. Students will feel and see those changes immediately. The move-in process will be different. Housing is staggering students' arrival. 5 students per household are permitted to move in every 3 hours. Parents and guests are not allowed to enter resident hall living spaces. And the usual events and activities surrounding move-in will be modified. And you can bet every inch of every residence hall will be ready.
Just cleaning and maintenance and making our facilities completely ready, so when students start to arrive on August 8th, they have a clean and shiny residence hall room that's been gone through and sanitized, and all of our common areas are sparkling and ready to be occupied.
Now, Jeff Corpy said the residence halls are at full capacity. One hall, Spalding Hall, is being set aside for students that may need to quarantine. Mike, what are you expecting those first couple of weeks?
Well, that's a good question. You know, we'll get some idea on the prevalence with the testing that we're doing. We started testing this week, and obviously we'll continue starting next week through that process. You know, we're ready for it. We've got a plan in place, working with our health center. If somebody does end up in isolation or quarantine, we're working through delivery of food, other amenities that they might need in that 14-day time period. We've got, fortunately, we have a facility that will allow us to do some of that, and hopefully, you know, best case scenario, we don't have to put anybody in there. But you know, realistically, I'm sure we're going to have some usage of that building. So.
And you know, we have just about a minute left. Final message for students. What is the most important thing that you want them to know?
Just, you know, be patient. You know, we're all in this together. You've heard us say that, you know, throughout this show and other communications. And the faculty staff, work with each other. If you're not feeling well, don't come to school, don't come to work. You know, work through that so that we're trying to keep everybody as safe as possible. Wear your masks, social distance, not only on campus, but off campus. You know, when you're out in your everyday activities, you know, be safe, you know, to make some good choices, and hopefully we can open up and they'll have the experience, albeit different experience than what they're normally used to, but we'll be able to function and have classes. So.
And Cindy, a final message from you for students?
My photo message is that the things that will help us the most to keep campus safe are very doable things. We are not at the mercy of this virus completely. There are things we can do to keep it away from our homes and our residence halls, and that's wearing the mask, social distancing, washing your hands, and trying to be as safe as possible when you're around in large groups. So doable things.
Absolutely. Well, Mike and Cindy, I want to thank you both for your time today. We covered so much of what is happening right now on campus. Certainly we don't have time for everything, but it's clear this is a campus-wide effort and we wish you all the best. This has been a special media meet. Thank you to those of you watching and those listening on Public Radio 90. For WNMU, I'm Elizabeth Peterson. Stay safe.
Really well done.
You know, that you just kind of see this kind of stuff. And we've been working with WNMU literally right before Mike was in the studio. I was in the studio and we did a media meet with myself, Rick Kubik from Michigan Tech, and Rod Hanley from Lake State, focusing on how all the universities are doing that. We didn't have time to show you that one. And besides, Mike and Cindy certainly showed me up in terms of their ability. I think they'll give Dr. Fauci a run for their money, for their fame pretty soon. You know, one of the things you heard about in the Media Meet program was you heard about the work of communication and dining and facilities, safety, PPE testing, all of those things. Thought it'd be useful to go into just a little bit more depth. Thought we'd start with the logistic team members. And Mike, let's ask you if you wouldn't mind coming up and giving us a little bit more depth on that, showing us some of the physical spaces. Knowing, I really do wish I could take you around campus and show you all the physical changes that have been made, because it has been really impressive and taken such enormous amount of work, not only on the part of Mike and the facilities team, but everybody on campus. So Mike.
Thanks, Dr. Erickson. As you saw in the video, Derek talked about our signage program, and we kind of put a walking tour that I'm going to narrate of the first floor at Jamrich to see what someone entering the building and what they're going to see throughout the building. So from the outside, we've got signage on all the doors. There's, depending on the number of banks of doors, is obviously the number of signs, but just that messaging, you know, masking, washing your hands, mask required. When you walk in, we're going to ask everybody to stay to the right of the hallways so that we can kind of minimize the traffic. So you're looking down the Jamrich hallways, these signs are placed on the floor and on the stairwells. So as you enter the stairs, you'll see that you need to walk to the right. These signs is placed throughout all the common areas. And we found that we're actually gonna have to put a few more signs up just because of the space. 2 people per elevator. And if 2 people end up at the elevator and one says, hey, I don't feel comfortable, they'll have to wait. Going into every classroom, masks are required. We were able to work with our printing services area to make these work. This is in the lecture hall, and we're kind of rethinking this one a little bit, but every 4th seat is the one you have to use. So we're going to have things marked. This is one of the classrooms. You've seen these before, but what we did is we put a sign under each table, just in case these tables get moved, or the tablet chairs more than likely could get moved. In our lecture halls, we'll ask people to sit behind the plexiglass. It's the only way we could use every row, or else we would have been down to that 25 to 30%. Every classroom has a room capacity sign with what's in that room. And when the number is students plus a faculty. So, and then in through our bathrooms, they'll see it everywhere. We're gonna message everywhere we can with the social distancing, the mask wearing, and the stay to the right. So I think if you come up the steps here, you'll see one up at the bottom of the stairs and the top of the stairs. So we've been spending a lot of time visiting every space. What we did is we put a team together to kind of preset the rooms. And then Jim Toms from the facilities department and I are visiting every classroom on campus and doing the final setup to make sure we're not only taking care of the social distancing requirements, But I'm also working on make sure we're covering all our ADA requirements and fire codes. Because in order for us to do some of these rooms, we've had to put tables and chairs in spots that we didn't normally, but we have to make sure we're complying with all the codes that are out there. So it's been quite a process. Like you heard me say on the media meet, we could do a whole afternoon on all the people we need to thank in this, because it's been just yeoman's work trying to get through this and get us open. So. We're wiping things down in between. So.
Thanks, Mike. I want to give a particular shout out to Derek Hall and his team for what they've stepped up in developing the signage. You notice on the signage, there's this consistent imaging that happens through. And so, the ability to really get that out, and I walk around with my packet of, all the signage and so forth. I'll leave it on my desk should you want to look at any of these things. Again, we'll make consistent modifications to that. So with more on communication, let's get Cindy to come up. The board had several questions about daily monitoring. I want Cindy to discuss that and community communication. So Cindy.
So I did want to come back to the conversation we had about the daily monitoring. Colonel Adams was kind enough to create a form for us, a monitoring form that we'll use probably more on a weekly basis or a couple times a week, because it's very comprehensive. We're also putting together, as we had discussed a little bit, but I wanted to kind of circle back to this, what we would do that's a little less intensive for our morning meetings. Dr. Erickson, we did this during the end of the winter semester, where we were meeting as an executive council on a daily basis. And we want to have these meetings in the morning, at least through the first portion of the semester, to see how things are going. It may be that we'll decide after a certain period of time that we don't need to meet every day. Maybe it's every couple of days, or maybe it's on an as needed basis. But Mike will be serving, as he did last semester, as our point person for the kind of the overall daily information collection, and I'm his backup, and we both have backups as well, of course. You want to have good emergency planning, and we want to set the role model for all of our departments. So within that, so I want to talk a little bit about the daily monitoring process that we will have. We will have, Mike will be calling, as he did last semester, the Marquette County Public Health Department officials and the hospital officials in the infectious disease department to gather any information we need to know that's on a community-wide basis, or any information they have for us about students, faculty, or staff, not again necessarily giving us names, but trends that might be coming that they're seeing that relate to the campus or the community. We're also going to be looking at a couple of quantitative measures. So again, it's hard to collect a lot of accurate numbers, at 7:30 in the morning. But our goal was, we kept thinking, what could we use that would give us a quantitative measure through systems that we already have in place. So we're not totally building something new, but we're grabbing, our systems and using them taking them to another level. So what we decided upon after a lot of discussion with a lot of people is that we're going to use our building camera systems, which actually can give you a number of people coming through the door, as well as our card swipe, our card swipes for a lot of the doors. And then again, our card swiping system that we use for meals. So we know in any given period of time about how many people should be coming through the doors based on how many people are in classes in that building. And we also have a sense of, how many people wouldn't come or what the regular traditional absenteeism is on any, average day. So we have some pretty decent understanding of what the numbers should be, but certainly after the first week of classes, we'll know what our baselines are for this particular semester. So if we see significant changes that we don't anticipate, then we know we have to have a discussion and start digging deeper to find out what's going on. And what I mean by that we don't anticipate, So if we know there's a snowstorm coming, we would anticipate that our building entry numbers might go down. Or if it's November 15th, a national holiday in the UP, deer hunting season, our numbers will go down. We'll also be using as a quantitative measure the COVID reporting forms that supervisors have to do for our employees. Anybody who is sick and isn't able to come onto campus has to let their supervisor know. They fill out an intake form that goes to our safety department, and that will be a number we can quickly and very easily in the morning monitor on the faculty and staff side. So the building numbers really give you a pretty good student number. I mean, obviously there's faculty and staff walking in the building. The majority of people are students. The intake forms give us a sense of the faculty and staff and employee numbers. And the card swipes, again, as a student indicator. You know, the idea there is that if you see a dramatic drop in people going into the dining halls, the different meals, then you wonder if they're sick and they're not able to eat. So we'll be able to use those three measures as just really quick measures. They don't tell the whole story. You certainly still have to do some investigation, but they're quick numbers that we can get. And these numbers can be dropped into a database. We'll have our technology people are kind of creating a simple form for us where Mike can input any of his information from the Marquette County Health Department and from the hospital. And these numbers from our systems will automatically drop in. And then we'll have an area where any of the work group chairs or any of the leadership team across campus can input information that they're seeing that they want the executive council to know about, as that could be, you know, indicating something that we need to investigate. So as I mentioned, we plan to meet every morning, at least for a while. And that kind of gives you an overview of our quick morning meeting. And again, in Colonel Adams' document, we have a more comprehensive form that will involve a lot of numbers related to, you know, what are the numbers in the county for COVID and campus and the state. But those will be more that we'll use that on either a couple times a week or a weekly basis. Any questions about that before I hop to the next one? Okay. So I just very quickly, we won't spend a lot of time on this, but I wanted to touch base on the idea of communication in the community, because we didn't talk about that too much last time. But these are some examples of some of the things we've been doing out in the community. President Erickson has been everywhere. A lot of people want to talk to him about what's going on campus. And so he's been gracious to do so many interviews. He's been doing many radio shows. He's been on the Ryan Report. He did the town hall with the other parents or with the other presidents. He's done the town hall for the community. He's done a fireside chat for the alumni. He's done parent orientation sessions. In addition, we invited about 400 of our community leaders to watch this meeting today. They can watch it live or they can watch it later. It's a link, so they'll know that it's available to them. We're doing a webinar, a panel discussion for the Lake Superior Community Partnership next week. I think that's a Thursday. And then our Downtown Development Authority is helping to facilitate a discussion for us. They've set up a discussion that the president, myself, and Mike will be having with the bar and restaurant owners and managers. I thought that was relevant before, and now with the new EO coming out, it may be even more relevant as we move forward, as things change with that area of business. Obviously, we're doing the special media meet that you just saw that will be aired, and that will be a link that can be easily shared as well, again, with parents and other groups. And in development, we have a social media campaign kind of being developed where students can send a question to the president and he'll ask it, and that'll be on our social media channels. And they're also doing a "What's it going to be like" student video. I don't really know exactly how far that is into production, but I know it's on the to-do list here in the not too distant future. And right after this board meeting, when the board press release goes out about your actions today, it will be tied with a whole series of stories about some of the work that's been done by the work groups on the Northern Today news blog. So those are just a few examples of some of the ways we're trying to message, not only here on campus, just to faculty, staff, and students, which we do a whole series of. There's emails that go out. There's not just from the president or from Mike's office, but also from housing, from student activities. So that's the on-campus circle of communication. But I thought you might be interested in just a few examples of what we're doing to reach out beyond the campus. Any questions? All right. And we're going to now, in the video, you saw a lot of the different work group chairs. So the people you didn't necessarily see in the video, we're going to have them do a quick update for you. But we will start with the Health Matters people.
Yeah, and as you know, we did start testing on Monday. I have to say I was over here and I was just thoroughly impressed at the smoothness and the ease and the direction that testing happened. So I'm feeling very confident. So let's have Dr. Kirkpatrick and Dr. Mann come up and give us a bit of an overview on the Health Matters.
Good afternoon. I'll revisit some of the different major topics that we've discussed previously. Dr. Paul Mann is with me again today, and I believe we have a student that'll be talking about some of the coursework that he's done with them as well. We'll start talking first about the mass testing event. Looks to be set up very well. We had a testing event on this past Monday. We did 250 samples of students, faculty, and staff members at that time. Priority with that was getting some of the housing staff, the resident advisors, the resident directors that are coming on campus sooner than the other population. To date, I've done about 400 tests that we've sent to the lab in Chicago. I've received 0 positives back from them to date, which is very nice. I'm happy for that. I'm very pleased that we've had significant help coming from the nursing department and the clinical lab department. We have a large number of student nurses and clinical lab students that will be helping us with the mass testing event, actually collecting the swabs or assisting to help collect swabs and the order entry. And so they're getting clinical hours, as I understand it, and doing a wonderful service for us as well. The IT team was highlighted in the Media Meet program, and they've been fabulous to work with. They've created this Passport app, which is logistically, one of my biggest concerns was all of these tests, 8,500 tests coming to me and my duty to report them. And so they've come up with a secure method of us being able to push results to that app, which is exciting. Still positive tests that need to be recollected, or if there was a problem with the sample, those will be communicated directly by myself and my healthcare team. When we talk about the on-site testing equipment, we talk about the mass testing being our initial prevalence study and trying to catch those asymptomatic cases that we may not capture otherwise. The on-site testing equipment is essential for our ability to respond to changes as they occur and to try to catch developing cases after that mass testing. We do have all 4 of our hardware machines on site. The chemistry analyzer, the Vitros that we've talked about previously, is operational and is currently doing antibody testing of the blood. The BioFire, which is a nasal swab that will check for coronavirus and also 20 other bacterial and viral pathogens, is on site and is going to be set up in the next week or 2 and validated, so it should be online before students arrive. The Sophia 2 units, which can give us a 15-minute test for coronavirus, is something that we've had on site because we utilize that for flu testing. The cartridges that will be used for coronavirus have been ordered, and we're awaiting the cartridges for that and also the test kits for the BioFire. Lastly, I'll talk about the quarantine hall and isolation hall before turning it over to Paul and his student. At this time, I have one full-time nurse, temporary full-time nurse who's established, who's going to be assisting with the daily monitoring of patients in isolation. We've worked together with the Marquette County Public Health Department and established protocols and run by them all of the different things we're thinking and the operations and logistics of that hall. I will be working directly with the infectious disease control nurse at the Marquette County Health Department. We're anticipating daily calls there as well. The advantage of being the medical physician is that while the administrative team gets the big picture about positive cases, I have the granular data. I have the direct contact. And so I'll be doing that in conjunction with the Marquette County Health Department, dealing with these on case-by-case basis as well. I have a second position for the nurse that I'm in the process of filling right now, so it should be fully staffed at that point. Paul, I'll turn it over to you to talk about some of the surveillance and research-based testing.
So as you know, we plan to set up surveillance testing this fall. There'll be both antibody testing and PCR testing. The PCR testing instruments have arrived. I have a faculty member who's working on campus right now to get those assays up and running, and they will be validated by one of our clinical molecular genetics master's students as part of her thesis work. We have identified a number of undergraduate student volunteers who have agreed to work with us in the fall to actually conduct that testing. And many of them are in a special topics course that's being taught this fall. The intent is for a volunteer portal that includes an educational module. And that educational module is actually being piloted in the course that I'm teaching this fall. So all of the students have previously been assessed on the components that are in that module that would teach, that would help to educate volunteers who are interested in being tested. And one of their assignments this week is actually to provide me some feedback on how I can make that better as it relates to students and others who don't fully understand the COVID-19 situation. And with that, I'd like to turn it over to one of the students, Arabelle McLaughlin, who is one of our CLS students, and she's taking that course right now. She'd like to provide you with a little feedback on it and tell you how bad of an online instructor I am.
So, like Paul said, my name is Arabelle. I'm a senior in the CLS program. I have a concentration in molecular diagnostics, and I also have been working this summer at the NMU Health Center, helping with their COVID antibody draws. And the course has been super helpful for me in my perspective, coming from a clinical lab science background, to kind of understand a bit more about NMU's plan on how we're actually going to be doing our COVID testing and just the science behind COVID-19 as we know it right now, because in the news, there's a lot of misinformation, and it's been definitely helpful. And I would recommend it for people who are in the science field going to NMU that want to know more about the virus itself and understand how the testing for it actually works.
I think that concludes our mini brief, unless you have questions for
Any
myself or
questions
Dr.
for
Patrick.
Chris or Paul? We feel in very good hands with both Chris and Paul and the work that they're doing. It's really, really extraordinary to watch the depth of the work. In fact, they're developing such a reputation. We're starting to get requests from a broader community to partner with us on some more testing. And for example, the superintendent of Marquette Area Public Schools has reached out. We're kind of exploring what our capacity would be. We'd like to help the community as much as we can, but we still need to make sure we've got the capacity issues in place to be able to do that. But that's just a reflection of that. So thanks so much. We'll let you get back to work though.
Yeah, thank you very much.
So as Dr. Kirkpatrick referenced, you know, the massive COVID testing project that started off just couldn't really happen without the technology team that supported them. And the work they've done has been just absolutely flawless. The event, which of course we're all calling the Passport to Campus, is just one of the many technology projects that this team has been working on. So let's hear from Felicia Flack and from Chris Danek and Chris Lewis.
Good afternoon. My name is Felicia Flack. I'm the Assistant Vice President for Information Services. And along with my colleagues, Chris Danek and Chris Lewis, we're going to tell you about the work of the Technology Subcommittee. So we had two primary objectives, and one was to support the technology needs that were identified by the other work groups, and secondly, to support a successful reopening of campus. So our work primarily centered around health, academics, and customized software solutions. Right away, we met with Dr. Kirkpatrick and Dr. Mann to learn about their plans for testing. And Dr. Kirkpatrick actually invited me to the first test of the police cadets over in the Jacobetti Center. And it was clear from that we needed to improve the process. And so our tech team took the data collection web app from Tempus and actually re-engineered it and came up with a really good streamlined application. And then we worked with Tempus to see if it's something that they could support. And they did. And what we've got in place today is really cool. We worked with the health center, Dr. Kirkpatrick and his team, to review and purchase a laboratory information system. And that's the software interface between the new machines in the health center and the electronic medical record system. Supports a lot of different automation and a requirement. We worked with the counseling center, a place that had primarily done business in person. So we worked with them and helped them get everything in place that they need to be able to provide telemental health services. We purchased a thermal camera and looked at that, set it up, and then turned it over to public safety. And I know they're looking at that and finding ways and places that might fit in. And with regard to contact tracing, although it is done by the public health department, we looked at and tested a couple apps that could be used privately by individuals that could help them remember all the places that they had been. It used latitude and longitude, but it turned out that they really weren't very accurate. And you know, we'll keep our eye on that and continue to see what comes up. And the second piece related to contact tracing is the special user interface that Chris Danek is working or creating, so that Dr. Kirkpatrick can use it for internal contact tracing. So it pulls data from several different systems presented in one interface for him to look at and record other data. So I'll turn it over to Chris Lewis to tell you about the academic side of things.
Hello, everyone. As Felicia said, my name is Chris Lewis. I am the Director of Technical Support Services here on campus. We knew right at the end of the semester that we needed to go in and we needed to talk to our faculty, and we needed to find out what worked for them, what didn't work for them, and what we can do going forward to help things move along efficiently and effectively. So we got a survey out right away, and we got some results. We got a lot of results in from everybody. And we learned a lot of cool things. We broke it down into three main categories. We broke it down into hardware, software, and training. In the hardware category, we had things like microphones, document cameras, and webcams. It was kind of interesting reading these because, you know, every laptop has a webcam and has a microphone built into it, but we have some very dynamic instructors on campus who like to move around and like to teach the way that they like to teach. So we needed microphones that would be able to pick that up in all different areas and, you know, make sure that audio is portrayed through Zoom effectively and efficiently. We also knew that this coming semester, there were going to be barriers in place. There were going to be masks. There are going to be shields. There's going to be plexiglass, as you guys saw in the video. So there needed to be pickup microphones in the rooms in order for the classes to be able to hear the instructor speaking. So the awesome team at AV was able to go through and they installed a bunch of microphones in a lot of rooms. They were able to get those configured so they're ready for the fall with this new audio stuff and they're ready to roll. We had document cameras going out the door like crazy. The faculty members were using those at home to teach remotely. So a lot of those were ordered ahead of time for this coming year. So, you know, there were a lot of things put into place right away. And the team at AV was really good in, you know, identifying what needed to be done and getting it ordered early. Right now, there are a lot of schools vying for the exact same piece of hardware. So a lot of things had to be done swiftly to get that going for us and get that order in ahead of time. From the software side, we identified pretty quickly a piece of software called Ally, which is super cool. This software integrates into our learning management system and will take attributes and items that are uploaded by faculty members and convert those into like EPUB formats and screen reader effective formats. And it uses things like artificial intelligence and machine learning to do this. So if I'm teaching a biology class and I've got a document that talks about a bunch of birds and it's got a picture of a bird on there, but it doesn't necessarily say what kind of bird that is. The software can look at that picture and say, you know what, that's a chickadee. I'm going to put that out there. That way, when it reads that back to that person, they know exactly what they're looking at. So it's kind of a cool thing. We were pretty excited about that. Another thing that we did was we looked at EduCat. For those of you that might not know, EduCat is our branded LMS that we have on campus. It's just a program called Moodle that we use, and we're able to customize that and change it to whatever we need it to do. I have not invented a mask yet that stays up while I'm talking, so that's kind of a bummer. It also doesn't fog my glasses. So in EduCat, we allow our instructors to basically opt into their courses to have a component online, right? And a lot of our faculty do that. Some of them don't. So what we did was we wrote a program that will go through and opt them in for them. And the awesome team at the Center for Teaching and Learning were really good in putting together a template that these faculty members could use. So when they get their course automatically created for them, if they didn't request one, they've got this great template in place that's ready to rock and roll right from day one. And they've put together a lot of our tools and a lot of our things that are in use, so they're able to get going right away with that. And then finally, in the software side, Zoom. All of us got really big into Zoom in the last 6 months here. So luckily, Northern was sort of ahead of the curve here. We have been using Zoom on campus for a while. So for us, it wasn't that great of a jump to start using that program. So we went through Zoom and we took a look at it and said, okay, where can we best integrate this? How can we make this work better? How can we help our students and faculty out here? So we did things like fully integrated into EduCat, and we also integrated it into our identity providing system for single sign-on. And we integrated it into a lot of our Google apps that exist on campus already. So that barrier with Zoom is low, but it dropped even more so. So our faculty were able to hop in there and start teaching their courses. And last, but certainly not least, is training. We've identified training as an ongoing thing. It's never going to stop. We're never going to get complacent in it. So we wanted to take our training and really change it around and make it the best it could possibly be. So this summer, the teams at the Center for Teaching and Learning and the Help Desk went through and they revamped a lot of their training. They updated it, they changed it, they made it more streamlined. So when you're looking for something, you find it right away. No one's clicking on page 2 of your Google search results to find an answer, right? So you need that, you need those results right there in the present. So we made sure to go through and put that stuff right up at the top so faculty and students can find what they were looking for effectively and efficiently. So those are some of the main components from the academic support side of the house that we did. This isn't everything by any means. These are just sort of the big, highlighted areas we wanted to talk about. So with that, I'm going to turn it over to Chris.
Good afternoon. I'm Chris Danek. I am a senior programmer analyst in the Information Services and Business Intelligence Department. I'm going to talk a little bit about some of the customized solutions that we programmed specifically for the COVID-19 crisis. The first being a PPE ordering system that would allow our safety department to bulk order PPE supplies to give us greater access to vendor suppliers and also give us a potential cost savings. Our second project is the agreements that were given to both the students and employees to understand their responsibilities in maintaining a safe environment on campus. And the third project is the Passport to Campus, which was created to safely and efficiently welcome everyone back. It was designed to minimize physical interactions and bring all of the beginning of the semester tasks together in one convenient place. Unique to this semester is that COVID-19 screening that we are sending everyone through. Now, not everyone's very excited to get a nasal swab, so we wanted to make it as convenient as possible. The start of the project was building the initial schedule of 14 days, which starts on August 3rd. The schedule was initially split up into 10-minute intervals where the number of spots depends on the number of testing stations that are set up. Then at that point, we distributed time slots among the schedule that work with various groups' needs. For example, we wanted the volunteers working the Passport to Campus event and the Housing and Residence Life staff to be tested first, as they would be having the first interactions with the remainder of campus. We also had some other special requirements where some started jobs early or courses early and other various special scheduling requirements to account for. After that, we wanted any of the students that are already local or any of the employees that are still in the Marquette area to be tested first, so that then we could be ready for the August 8th move-in for the residence halls. With the residence halls, we had an extra limitation to promote social distancing where we only wanted 5 students per house moving in a 3-hour block. This was certainly a challenging experience, and I've got a lot of emails between myself and Cindy Pavlo to show. So after we got the schedule built, we distributed the link to campus where everyone was able to log in and see their groups' times and then sign up for their desired date and time. After they picked their date and time, they had a confirmation email sent to them. You can see on the left that displays their date and time that they had picked. And if any point in time their plans change, they can log back into the app and pick a new date and time. The morning of their appointment, they will receive both a text message as shown on the right and an email, which will remind them of their time again. We ask that when they arrive, they remain in their vehicle so that they can stay comfortable and prevent congestion at the front door. And then they can let us know that they are here in one of 3 ways. They can either respond with the word "here" to that text message. They can click on the URL that's in that text message, log in, and then click the "I am here" button. Or they can open the NMU mobile app and click the button at the top that will bring them right in the Passport to Campus app. Inside at the check-in desk, staff are watching that door to make sure we don't have a lot of congestion, and then they can invite people in via an administrative interface as they are ready. While waiting, we moved any necessary consent forms to an electronic format where they can be filled out on the person's own device and capturing a digital signature, making this a truly contactless process. Those forms involved a consent for the COVID-19 screening, a TLC agreement if they'll be getting a laptop, and then if the student is under the age of 18, accompanying forms that need to be completed by their parent or guardian. Once we're ready to invite the student or employee inside, they will then receive another text message. And then if they have the Passport to Campus app open on the right, you'll see, it will also display on there that we're ready for you to come in. Once the student or employee has arrived at the check-in desk, we will distribute their 2 NMU face masks. And then the Passport to Campus app will guide them through the rest of the stations, which starts with the COVID-19 screening, following by the pickup of their parking pass, Wildcat ID card, housing keys, and laptop. That list of tasks is generated dynamically based on integrating data from other systems showing only what they need to do. And that list will update in real time, showing a green check mark as they complete each step. And as mentioned earlier, we ran through this process on Monday and it seemed to go really well. I was actually towards the end of all the stations and I heard a lot of positive feedback that it was a very quick and easy process. This allowed us to keep everyone moving through the lines and maintain social distancing. And Passport to Campus is helping us welcome the students and employees back in a safe way. Thank you.
So Chris, tell them what happened on that first day with Tempest, changing the system in the middle of us doing our test run.
So the lab and the vendor we were working with, Tempest, we'd been working with them for probably about a month at that time to develop basically a form that we can kind of pre-fill data from our banner system on our side and bring that over to a form they have on their side to actually submit the order. So this isn't really a solution that we'd prefer from the IT side because it can open up for a lot of error. So when communicating with Tempest, we said several times, you know, there's a lot of potential for error here. And if your form ever changes on us, that could really impact our process. And we heard, yep, we'll let you know, we'll let you know. About 10:30 on Monday morning, their form changed in the middle of the day. So we had to get in there and write some code real quick in about 20 minutes to be able to patch that real quick. Because what happened is basically they changed all the address fields. So now none of those are pre-filling. So now basically the people doing the data entry had to fill in the patient address, the university address, and now a new field that was only supposed to be required in your first order, a billing address. So that kind of threw us through a little curveball for sure.
Yeah. We like to test you guys out.
Yeah, keeps us on our toes. Thank you.
Well, they all have done a great job on this. I appreciate the work.
You know, one of the key elements for us in this whole thing is ability to be flexible and to change and adapt as we go. And I don't think there's any place that exemplifies that more than what's going on with housing. You know, we started off in housing, you know, thinking we were going to have, you know, more capacity than we needed, set aside Spalding Hall, 300 beds that we could use for quarantine and isolation and so forth. Then we find, of course, that the demand for housing has spiked, which is frankly a great problem, but a problem nonetheless. And so I've been just really pleased with the work that Jeff and his whole team have done in terms of dealing with that issue, but all of the other complexities that are going on with housing. So let's turn this over to Jeff Corpy.
All right, good afternoon and thanks for having me. I brought a couple of special guests with me today. I have Isabel Asmani, who's a full-time resident director in Cedar Hall. And I've also brought Val Gage, who's a resident advisor in Birch Hall. Both had served as we got into the pandemic last year and are currently in training. They're out of training this afternoon to be with us here today and will be serving in their capacities this upcoming fall. They're going to talk about training here in just a few minutes. I want to provide you with some status updates though as to where we are now. Residence hall and apartment living area cleaning will be completed as of today. That was our target, 5:30 this afternoon, and we will turn over to public area cleaning and wrapping that up, the cleaning and sanitation of those areas next week. The last time we spoke, we talked about putting all of our beds in quad 2 into a new configuration, which you can see highlighted here. And so if you look at this photo, what would be right here in this far corner would be the other student desk. You have 12 feet corner to corner separation. And in terms of the beds, if students leave it in this configuration, pillow to pillow, you have 12 feet as well. So we did our best to create the distancing in the rooms, and the Woods rooms are about 30% larger. So in terms of distancing in those rooms, we didn't have quite the issues that we had in the furniture configuration in quad 2, but we have solved that with this new configuration. Little bit about Spalding Hall. I know Dr. Chris mentioned Spalding Hall earlier. All of the bedding has been procured for Spalding Hall, as well as refrigerators, fans to help it be a little more comfortable in there. I think Tom's crew is getting some microwaves as well for those rooms. So students, if we do indeed have to use Spalding Hall, that we have some comforts of home there. And we're also looking at providing some decoration on the wall just to add some color to a 50-year-old residence hall to brighten that up a touch. Fritz mentioned occupancy. Certainly outperformed where we thought we would be. Our current number today is 2276, which really, quite honestly, with the number of singles that we've sold, puts us about 5 beds from having to get creative somehow. And so it's a great problem to have. You know, when this whole thing started, we thought maybe if we hit 2,000, we'd be lucky. And so to be at 2276, we feel really strong about that. Another number that we feel strong about is the number of students who've signed up for a move-in time already. We're at 2113. We're still 10 days away. I think that's really strong. We have less than 10% that still need to fill up for a move-in time. Feels great. It tells us people are committed to joining us here really soon. Some other updates. We just wrapped up resident director training. I want to highlight the work that those folks are doing. That entire team returned to us for this upcoming year. And so because of that, we were able to tighten some things up with their training to allow RAs to arrive earlier to provide them more training, giving the expedited move-in time. And so our resident directors have been hard at work to accomplish their training and bring the RAs on who moved on last weekend. And so we have 60 RAs joining us, and I'd like to turn it over to Isabel and Val to talk a little bit about what they're seeing in training.
Hi, everyone. As Jeff said, my name is Isabel. I'm a resident director on campus. A little bit about training and how we used the opportunity that we were given to stay open last winter at the start of the pandemic, and how we use that to plan for training, a successful training for our RAs or resident assistants on campus. So one of the main pieces of information that we learned from staying open last winter was how important our individual relationships are on campus, especially within our housing department. It truly brought us back to our roots of individual relationships, personalizing everything, and making those small one-on-one connections. So when we were planning RA training for this year, that is truly the umbrella that we are falling everything under. One-on-one connections, everything is going to be a little bit more intimate, as in smaller groups, and a little bit more consistently done. We're putting ourselves out there into those communities to make sure that students feel welcome and safe and comfortable. And Val's going to talk a little bit more about her experience with training thus far.
Hello. So as Isabel said, my name is Val Gage. In RA training, I think it's exciting to see how Zoom has been used so far, because as a student and as an RA, obviously that was one of my biggest worries, was how to do it safely but still be connected. And honestly, I haven't felt any disruption in that connectedness with Zoom. Actually, a lot of the RAs already prefer it over kind of face-to-face, because you get to see the personalities and the suggestions from the people who are less extroverted. They get to throw in their ideas, they get to throw in their opinions through the chat version. So a lot of my staff was talking about how excited we are to use that in our House Gov or Hall Gov, because then that gives our students a bigger opportunity to get involved without having to be involved. So we're actually excited to see, because I personally believe that our community may be stronger, because right now we have the freshmen and the sophomores and everybody moving in that are still trying to gain their footing and gain their friendships. So I feel like community will be made stronger in this, because there's less opportunities, not less opportunities, but more opportunities to make it within the hall. Yeah, so back to Jeff.
Thank you all. So yeah, as we talk about move-in, we are 9 days away from move-in. And I can tell you we're feeling confident and ready. So Saturday, August 8th, we'll have our first batch. We have just over 400 residence hall students ready to move in that day. And we will have about 70 welcome crew members who are all student volunteers moving in this week, ready to assist those folks on that Saturday. And so some of the things we've done with move-in, you can see the bins that we've purchased here. We have approximately 100 bins like this for campus. They typically are just a straight cardboard wall all the way up to the top. We did purchase these vinyl wraps, which allow them to be sanitized and cleaned after every single use. And again, our students will be ready to help students get those into the living spaces, because again, we're not allowing parents or visitors into the living spaces, but we'll have those ready and student help ready to get those in to the halls. We are, planning things so parents can say those special goodbyes. We know how important that is. And so we're arranging for, some events in our lobbies, but especially outside for students to have those opportunities with parents to say goodbye and make it meaningful. A couple of highlights just before I go. We had a really short summer. We were moving students in 2 weeks earlier than usual. We certainly ended the semester under unusual circumstances last year. I just want to highlight our facilities and maintenance staff that did such an amazing job in sanitizing and cleaning our facilities, as well as our Res Life staff planning the training that they did. Knowing that we can boast we had the most students stay on campus last year. Certainly, I think that helped our occupancy and gives students confidence in signing up and re-returning this year. So appreciate their efforts and our main office, but our student employees. Our student employees were phenomenal. We had 60 student employees on staff this summer, working in student custodial jobs, desk jobs. Doesn't include the student employees that we had stay on campus at the end of last year, and the student employees are getting ready to serve us for this upcoming fall. And it's certainly all about students, but their efforts help us run and keep things moving. So thank you. Entertain any questions if we have any. Sure. Why did we choose Spalding Hall? Really had to do with its location. Spalding's Hall location being away from the other halls, not attached to the woods in Quad 2, I think was probably one of the primary factors and why we chose Spalding Hall. And the fact that we knew our occupancy was going to, probably decline a little bit this year with the pandemic going on. And so it made sense to try to keep Quad 2 in the woods intact and use Spalding Hall in this creative way. So I personally, I don't view the asbestos as the problem. It's been encapsulated completely in that hall, and it's been certainly deemed safe. And so we've coated the ceilings with a product that encapsulates it to the ceiling, and it is below the floor tile. And again, anytime we have issues with that, which is extremely rare, and Isabel could probably speak to that. She was a resident director in Spalding Hall for 3 years. I don't think you saw one issue with that in your entire time there. Okay. Sure. Right. Absolutely. We have students acknowledge the fact that there is asbestos in the ceiling, like I mentioned, and then below the floor tile. And so we want students to acknowledge that that's present in the building prior to move-in. And that way, if there is an issue with it, that they can report that to staff immediately and we can take care of that.
We'd be happy to have you talk offline with Jeff. The questions really need to be from the Board of Trustees. I'm sorry, this is from the Board of Trustees. We're happy after the meeting to have you speak with Jeff and answer any questions. So thank you very much. Appreciate that. Thank you very much. And thank you all very much for being here on the housing issues. These are absolutely critical for us.
Thank you.
Among the most challenging, certainly, I don't see it. Is Rob here and Christy? Among the most challenging issues, of course, are those issues that are directly related to the academic enterprise. I mean, that's what we're really all about. What's involved with the academic programming and so forth. And I have to say, I've been incredibly impressed, not only with the work of the work group, but of how the faculty and the support staff have approached dealing with the challenges of making sure we provide a robust quality education during this unusual time. And so with that, let me kick it over to Rob and Christy so they can talk with us about some of those things that are in place.
Thank you. So as you're aware, this fall, classes on campus will really fall into three types. We will have traditional face-to-face where all of the instruction will be in the classroom. We will have online learning where all of the learning will be remote. And then we will have what we have termed modified on campus. It was clear very early on as we started to prepare for the fall semester that we did not have nearly enough large classroom space to be able to meet with all of the students in many of the classes of the size that we have. So we, with the help of facilities and many people, we were able to determine classroom capacities. I think this morning when I talked to Jim Toms and Mike Beth, they had looked at 196 rooms, figured out their capacities. For the most part, they're at about 50%. Some are a little bit higher, many are lower. And then room assignments were made with the goal being that every class would be in a room that would hold at least 50% of the students in that class. With that in mind, we then reached out to the faculty and said that you will have to plan a way to meet with your students so that each class session will have a subset of your students. You won't be able to meet with all of them in most cases, but then we gave them great flexibility in what they do with the students that are in the classroom as well as the students who are not in the classroom at that time. As Chris Lewis said, we added some technology to the classrooms for those faculty who might be interested in doing things like using Zoom synchronously while they have students in front of them. They would also be reaching out to the students who would be at various locations. but many faculty have thought of other creative ways. One of the ways that I know is being used is something called the flipped classroom. In that model, the faculty member will post online lectures, PowerPoints with voiceover, videos, other activities. And then in the face-to-face portion of the class, the students will come in and the faculty and the students will have discussions about the things that they've learned outside of class, talk about topics that might be challenging, be able to, go in various directions based on the students' interests and needs and other learning activities. And so a great shout out to our faculty who are using their creative juices and figuring out how to best have these modified on campus classes. The committee has looked at a lot of topics. I just wanted to tell you that current topics of discussion include how are we doing credit-bearing off-campus learning activities such as practicums, clinical placements, internships, student teaching, and also what kind of classroom practices do we need to have so that we're ready in the case of the need for tracking and tracing. And that will include the challenges of implementation of assigned seating, as well as taking attendance in each class so that if we need to do tracking of a certain student, we know not only where that student was seated in the room, but who was seated around them. Also, I'm going to take this opportunity to thank the members of the Academics Logistics Work Group. It's a diverse group. It's made up of some administrators, the presidents of the 2 faculty unions, people from facilities, AV, as well as disability services. And so we've covered a lot of different people on campus. And I want to really point out that the faculty are on that group are donating their time. They've been very good about coming in and being very creative. With that, I'm going to turn it over to Christy to talk a little bit about the School of Nursing.
Good afternoon. I'm the department head for the School of Nursing, and I'm glad to talk to you today about the unique challenges of a nursing school during a COVID pandemic. So as you all know, nursing is a practice profession. We need to educate these students to be able to function in the workforces that they're graduating and entering. So in March, it became clear that the problem was the PPE supply, as you've all heard on the media so often, and not having enough PPE. We teach students to work with patients with infectious disease. That's our business. So it wasn't pulling students out of those settings because we were afraid of working with patients with infectious disease. It was there wasn't enough PPE and we couldn't take PPE that the nursing staff and other healthcare professionals needed. So hopefully that situation has been rectified. So as we plan to go back into our clinical settings, we faced a couple of unique challenges. And in order to address them, we created an internal safety committee. We also looked at the recommendations from our professional organization, the American Association of Colleges of Nursing. I serve on the Michigan Association of Nursing School Administrators, so I've been able to be in contact with my administrative peers across nursing schools in the state of Michigan. We talked to the Board of Nursing. We also consulted with public safety on campus and risk management on campus. And we created policies to return our students safely to our labs and our simulation experiences safely, as well as clinical environments. So what we decided to do in our labs and our sim center was to treat them as if they were the hospital setting. Nursing students cannot do social distancing in our lab activities. So for example, if you're learning how to do a blood pressure, you're going to have to touch somebody to do the blood pressure. In our sim centers, we have scenarios where they have to work in teams. For example, a patient's having a cardiac arrest. How do you respond as a team? That's so essential to their education. So we decided in order to maintain safety, we would address those areas as if they were inpatient areas. So our nursing students will have higher criteria Every day they come for a lab or simulation experience. They will have temperature monitoring. They will have symptom monitoring. We have special PPE equipment. They will have face shields as well as their face masks. They will be using gloves as appropriate, depending on what the activities are. And all of that is actually has been coming in, and we are assured that it will be here. The rest that isn't in will be here on time. We were also very creative in trying to rearrange space so that we could social distance when able. And then I have a wonderful lab staff member, Julie Dobson, and she was able to purchase some UV light equipment for disinfecting for some of the equipment that we have that can't be sprayed on or et cetera. So that was one issue we faced. The other issue was returning to clinics. We had to work very closely with the hospital, and we will continue to work very closely, especially their infectious control department. And we did know that some environments will not accept student nurses. Our long-term care settings have such restrictive environments right now and weekly testing of all of their staff, et cetera, that we knew that our first semester students would not be able to return to those environments. So we sought alternative safe options. In terms of clinic, we're bringing students back, and we already started these conversations, and we will continue to have them. And we're discussing the role of a professional nurse in working with people with infectious disease and the particular risk of working during a pandemic. Students will be reviewing materials and signing off that they understand that. We also have a program where every single nursing student will be re-educated or educated on the proper donning and doffing of PPE, and we have checklists, et cetera, and that will be done first week. And of course, every clinical day, the students will be daily monitored for temperatures and symptoms, et cetera. So finally, I had to have kind of a cultural look too. Nursing schools are kind of known as boot camps. If any of you have nurses in your families, they might have talked about going to the boot camp approach of nursing school. We have very, very high expectations, but at Northern, we tend to be very caring and student-centric, but we are a boot camp. We want to teach them those professional values. So there's a lot of thought into really raising our nursing students to be the role models on campus and to agree maybe once they arrive at campus, I know I can't monitor it, but we're really enforcing, please don't travel. Once you're here, stay until November, and then you can have a nice long break. We have a wonderful faculty member, Sarah Jennings, that's helping with the volunteer effort for the Passport Back to Campus that you've heard about. We have over 90 volunteers that we're training this Sunday in the Northern ballrooms to be safe in terms of donning and doffing PPE. And I'm happy to report that 67 nursing students and 14 nursing faculty members are donating their time to monitor these students. So our students really they didn't want to be pulled from clinic, and they want to be in clinic, and they want to be in labs. So I think we've probably covered everything we could to ensure we're as safe as we can be in this situation. Thank you.
Thank you very much. Any questions for Robert Christie? Now, excuse me, this is the board meeting, so the questions are for board members. You're welcome to ask questions after the meeting. Thank you. Thank you very much. So any from the board members, any questions? Thank you, Mike, for wiping down. Probably the least sexy group that we've had working on stuff is the Safety, Risk, and Enforcement Subcommittee. And so we've got Jill and Chris, Jill Compton and Chris Greer are going to talk about that a little bit. I would have to say that I've appreciated that Jill hasn't found me forgetting to wear my mask. I did sneak out the back stairway the other day when I came in without it, so I could race down to my car to get it. But really appreciate the work, because we get a lot of questions on how are we going to enforce all of it. So with that, Jill?
Well, I think Chris is going to talk about enforcement.
Chris?
Okay, I'll go first. So we have a document on the student site, student COVID site called Student Responsibilities and Safety Protocols. And that lists things like you're expected to wear a face covering in indoor spaces, avoid close contact, so the whole social distancing thing, stay home if you feel sick, quarantine, isolate if you're told to, and abide by health department and university health center rules. So the important thing is that this is all enforceable because we already have something in our student code called the official request. So violation of the student code can result in disciplinary action, and it specifically says that no student shall fail to comply with reasonable and lawful requests or direction by university officials. So clearly we didn't have to change our student code because we already had this in there. So that is our plan for enforcement. In addition, on July 14th, students received an email from Fritz saying that we're requiring masks. And so they have been told that. We have had some emails about it and phone calls about it, but they have been told. And we're planning kind of a phased in way of continuing this conversation with the students. So our plan is that we will have an email go out to the students again, totally about masks and about enforcement. So we're hoping that that will go out early next week. Then a follow-up will be sent on August 12th. And of course, if anything changes in between, we'll highlight those changes. And those changes would only take effect if our requirements must change. So we like our requirements right now. We're planning to stick with them. Then we have kind of a phased in disciplinary approach. So from August 3rd to August 23rd, we're calling it a warning period. So students will be warned that when seen without a mask, that you really do need to put a mask on and what will happen if you don't. Students can be referred to my office for a formal warning. They can be referred to my office even during that warning period if they have been told multiple times to wear a mask and they haven't. And I'm anticipating that will either come from housing or from faculty once classes start, if someone is refusing to wear a mask. If someone is in a classroom and refuses to wear a mask, they can be asked to leave class for that day, forfeit attendance points or quizzes or test scores or whatever might be happening in class that day. And they can be asked to vacate an area. So that would be like the dining hall, an academic building, a residence hall, common space, anywhere on campus where they're supposed to be wearing a mask, they can be asked to leave. Then we'll start formal discipline on 8/24. And this is based on referrals. So if we hear about it, we'll react to it. The sanction will be determined on a case-by-case basis. It will vary depending on previous student code infractions, severity of health and safety risks to others, etc. So, but there will be action taken, absolutely. And it ramps up to suspension if absolutely necessary. And we're hoping that we do not have to go there, but we are prepared to if we have to. Any questions from the board?
So I've been asked to update the board on 4 issues. And the first issue is regarding student attestations. So several work groups worked together over multiple weeks by Zoom, trying to develop a list of what we expect students to do when they're here on campus, and also how to communicate with students their rights on campus as far as safety is concerned. And when we were done with the draft, we solicited feedback from students. And as often happens when I work with students, the response from our students was very northern-like. What they said, what they told us overwhelmingly is that they will do these things, not just because someone is requiring them, but because they're the right thing to do. So based on their feedback, and this was an idea from the students, we changed the title of the document from a student attestation. And you know, we have an employee attestation, but for students, the document is called the Campus Community Compact. And so when the students get this Campus Community Compact, it asks them to do 3 things with some bullet points underneath on how they'll do those. It asks them to take care of themselves, to take care of others on campus, and to take care of people in the community. So that Campus Community Compact is communicated to students both in the document that Chris talked about, which is on the website, all the details of what we expect of them on campus, but they get that attestation page, that Campus Community Compact page, when they go through the Passport to Campus system. So I was waiting for Chris when he was talking to you to show that next thing that students do when they're clicking through what they need to do when they get here for Passport to Campus. One of those is that Campus Community Compact attestation. So that's just one more step that they follow when they show up here on campus and get their laptop and get their room key. They also attest that they are willing to take care of themselves and each other. The second thing I've been asked to talk to you about is an update on our mask exemptions. So several times we talked today about how masks are required on campus. The question is, how do we adhere to those requirements that say if you're not able to wear a mask, how will we handle that here on campus? How will we communicate that to others on campus? So we've modeled our mask exemption process on our existing ADA accommodation process. If someone who is an adult cannot medically tolerate a cloth face mask, which is what the CDC recommends for source control, then they can use that same process that we use for ADA accommodation. They submit medical documentation either to the Human Resources Department for employees or to our Disability Services Office if you're a student. And the medical documentation is reviewed and you're either granted or denied a mask accommodation. When we work together with faculty on that, because faculty who are in these classrooms with students were concerned that they wouldn't be able to tell who had received a mask accommodation and who had not, we again worked with IT, our fantastic IT department, and our faculty will receive both an email letting them know if one of the students in their classes has received a mask accommodation, and they'll also receive an indicator on their rosters that shows them that one of the students in this class that is in front of them has received a mask accommodation. And then we communicated with faculty about what they're allowed to ask in a class and gave them a script or a series of things that they can do if someone shows up in class. So the faculty feedback on that was good, and we think we have that one covered. So far, we have received mask accommodation requests, mask exemption requests, but when a person receives a medical exemption to wear a cloth face mask, we're steering them toward wearing a face shield. So we won't see people with no covering on their face. And if we do, we have a process set up for that too. If someone receives medical documentation that they can tolerate neither a cloth face mask or a face shield, we have a process set up in place for that. But so far, we haven't received anyone who submitted medical documentation saying that they cannot tolerate either a cloth face covering or a face shield. Okay. The third topic I've been asked to update you on is our COVID reporting intake form. I've seen it come up several times on the slides here, and I just want to make sure that everyone understands what that is. There's sort of a complex set of requirements that we have to follow to balance both a person's privacy when they receive a medical diagnosis and the responsibilities that we have to let people know when they've been exposed to someone with a COVID-19 diagnosis. So based on recommendations from the CDC and the MyOSHA group, we developed an intake form that is processed through people who have had HIPAA training so that they are educated on how to keep that information private as much as possible, and through our health center, so that we can follow all the requirements that we need to when somebody lets our Human Resources Department know that they've received a positive COVID-19 diagnosis. Let's see, the form is on our websites, and also Human Resources has used the process form as one of the items that they have been educating supervisors on in their weekly supervisor updates. And finally, we have the issue of our employee attestations. I've talked to you about that before. Those are coming along swimmingly. As we bring people back to campus, they are filling those employee attestations out before they are given access to come back into buildings. And as you recall, once the buildings are back open, we will do a IT comparison report to identify anyone who wants to come back to campus who hasn't already filled those out. And we will be following up on those both programmatically and with phone calls to make sure that we get those all in place before people step foot on our campus grounds. Any questions about those 4 issues? Excellent, thank you.
Thank you very much. One of the things that I've been asked on a number of occasions has been, what if a faculty member or staff member chooses not to test? There's been no ambiguity with my response. On August 17th, when classes start, if we have an employee that willfully refuses to test and doesn't have a legitimate excuse for it, they will no longer be an employee of the university. It is just pretty much that simple. And so we're monitoring that. We expect the same of our students. This is an important part of the process of making sure that our campus is safe. We think there's going to be, I really don't anticipate any problems with that. Nevertheless, we think it is really an important part. I was asked the other day, for example, a faculty member says, well, I'm teaching all online. And if I'm teaching all online, do I need to take the test? And I said, if you come to campus for any reason, that will be your last day on campus and last day working with us. I mean, we need to be that, there are some things we just need to be very firm with, and that is one of them. Certainly appreciate all the work with that Chris is putting in place. This whole idea of the community compact, I think, is really the right way of doing it. It's not a waiver, but it is a commitment, which I think personally is really important. Of course, we have human resource issues. You all know Rhea Deaver, our Director of Human Resources. And it is an unsettling time for our employees, and we've certainly had a number of requests for accommodations, and give great credit to Human Resources for being able to process those and deal with them and make sure that we are providing what it is that we need for our employees. So with that, I'll just turn it right over to Rhea.
Thank you. Good afternoon. So the topic that I wanted to cover with you guys this afternoon is actually related to the climate survey that the HR staff logistics subgroup actually sent out late June, early July timeframe as part of a desire to really understand where all of our employees were related to a number of COVID issues, specifically around how the university had been doing related to communication, how people were feeling about coming back from the fall or for the fall, what their remote work experience had been like. And that survey actually was sent out to all employees. That included faculty and staff. I think we had a pretty amazing response rate given we only had it open for 2 weeks. And you'll have to remember that during this time, we had a lot of employees who were furloughed. Faculty were off contract, AFSCME and TOP employees were furloughed, not all of them, but a lot. Kudos to the union leadership, particularly on the staff side, who I know worked extra hard to make sure that their employees knew to be checking their mail, their email, and responding to the survey so that their voices could be heard. So overall, we had a 63% response rate in 2 weeks, which I think is pretty amazing. You'll have to forgive me. I'm probably the slide heaviest presentation of your afternoon, but I promise to get through the detail relatively quickly. Just wanted to share some of the high level results with you that I thought you would find most interesting. First of all, just a breakdown by group. What you'll see in the first column there in terms of responded are the number of employees who responded from that group versus the total number of employees in that employee group. If you're adding up the numbers in your head relatively quickly, you'll notice that the responded number doesn't equal 626, which was total respondents. So just a reminder that it's an option for people to really provide us with their demographics. We don't require it. So we had more people responded than actually responding to the survey than we had identifying themselves as a particular subgroup of employees. The news here, though, is that we had great representation across the board. And then just detail in terms of representation across the divisions as well. And you would expect to see the largest number in academic affairs, given that is our largest employee group. So in terms of high-level results, the message here for us really overall was very positive. This first question, university has taken appropriate action in response to COVID-19 related issues. If you're sort of totaling up the numbers in terms of agreeable, what you'll see there is you've got approximately 75% of employees who responded in that agreeable or strongly agree range. So that, I think, was a true testament to all of the hard work that was occurring, not just during that March and April timeframe, but also all of the planning efforts that kicked off shortly thereafter to get ready for the fall. The next question, executive leadership does a good job of sharing information about the university's plans regarding COVID-19. We did define executive leadership as the president and the vice presidents. And again, the numbers here were very, very positive in terms of about 63% responding either agree or strongly disagree to that, or strongly agree to that statement. I think another important point to make here is this was again during a time when plans as it relates to the return to campus weren't necessarily clear. They were plans at that point in time, and the fact that people felt strongly that they were pretty much aligned and had a good understanding of at least where we were as an institution and a campus from a decision-making standpoint, I think is important, and also certainly underscores the importance of communication in general during times like this. Not that there really are a lot of times like this. Executive leadership has taken steps to demonstrate they care about the health and safety of employees. I think this is also really, really important. There was a resounding positive response to this as well. So kind of totaling up the numbers in case you can't see them, close to about 70% in the agree and strongly agree category there. I have confidence in the university's ability to be successful in this coming academic year. Numbers start to get a little bit more split here, which I think is understandable given the fact that every employee is in a little bit of a different place based on his or her own experience from a medical standpoint as well as from a work standpoint. But again, I think the numbers here are pretty positive in terms of somewhat agree and strongly agree, adding up to 75%, which obviously that's a large portion of the population that agreed with that statement. This one I think is also really critical because it speaks to the trust that people have in their supervisors and how safe and comfortable that they feel raising issues of concern, which again, during this time is that much more important. You've got close to 80% indicating that they believe that they can voice concerns if they feel that something is unsafe in their work environment, and they won't feel any kind of retribution as a result of that. So obviously there's been a lot of hard work that's gone into place over the last few months to try to bring people back to campus safely. And it's good to know that if people feel or experience something that they're not comfortable with, that they have an outlet to share that and a trusted outlet to share that information. We asked more individual questions too related to wearing facial coverings, just to get a sense of how people were feeling about that coming back to campus. And again, the numbers here overall were very positive in terms of people's comfort level. Hopefully that means that we won't have many issues in terms of employee issues as it relates to wearing a face covering. Again, here I am comfortable returning to work on campus. You start to see a little bit more of a split. Again, not unexpected given people's sort of personal situations. A number of staff and faculty, as you know, had been working remotely for a pretty lengthy period of time. For some staff at this point, they're returning to campus after not being here since March. That's a pretty significant transition. So certainly understand the apprehension from that standpoint. And then this question, again, definitely more negative in terms of responses. I am comfortable with visitors, so that includes prospective students, parents, community members coming to campus. Obviously, we have a number of people who are more frontline with the customers that we'd be seeing, parents and prospective students. This obviously reflects their general apprehension of people potentially from outside of the area coming to campus. This information, I think, helps to feed some of the decisions that we're making about how we're handling things like campus visits, face-to-face or virtual interactions with students and parents, just again, so that we can help people feel safe and comfortable in the work that they're doing. Just some additional insights. We did have about 100 pages of comments, which is not unusual when you're doing a survey. Typically, you do have, you want to give people an opportunity to share the good, the bad, and the ugly in terms of how they're feeling about their experience. The caveat here is, again, the survey overall was very positive, but certainly the group that I think showed the most apprehension is the faculty. When we break that survey down by employee group, that comfort level with coming back to campus, you've got over 40% indicating they disagreed with that. The general population was more at that 28.4%. And when you dig into that a little bit more, you can see that a lot of it is just around how they can safely teach face-to-face, as well as general safety and workload issues for a group that is obviously having to plan not just for a face-to-face experience, but an online experience and the challenges sometimes that they're faced in terms of doing that. Also, general concerns just voiced about the behavior of students and student compliance. So all the work that's being done as it relates to that space is of particular importance, and understanding what's being done in that space. Employees overall want flexibility in their approach to work. They want to feel like they're in control of their own safety and health and welfare. So as much as we kind of can meet people where they are from that standpoint, I think it'll be to our benefit. And then truly, the survey comments were just primarily about communication. And again, really the criticality of communication between the supervisor and the employee, as well as obviously the communication that's been coming directly from the president's office and our vice presidents. So we've been working really, really hard, working with the supervisors that we support to make sure that they've got the resources that they need, so that they in turn can share those resources with their employees in a way that helps people to feel comfortable. I will very quickly, because I know that you're getting to the end here of your overall presentations here, but I did just want to show you, we created a website where we sort of consolidated all of the HR and employment related COVID resources, including guidance for supervisors. As a couple folks have mentioned, we are facilitating supervisor forums every week, bringing together usually about a group about 75 to 80 supervisors to discuss what's on their minds in terms of returning people to campus. So a lot of detail here, including I also wanted to point out the wellness resources that we have available to our employees. Lots of information, not just about our employee assistance program, but also online mental health resources that people can take advantage of. Oh, is it not working? Oh, it came up on my screen, so I thought it was, you guys are like, what is she talking about, for Pete's sake? Do I have to just disable this? There it is, sorry. So it is broken out in a way that we think it'll be easier for employees to find resources. So as I mentioned, supervisor resources here, wellness resources, as well as other information as it relates to a safe return to campus. So the survey itself, I think, kind of continues to feed our planning efforts and our monitoring efforts going forward. So we're sharing that information out as appropriate with the other logistics groups, so they've got an understanding of where employees stand on some of these key issues. If you've got any questions? Yes.
Will you be doing another survey like in November or, I don't know, January or something like that, just to see have perceptions or reality have changed for staff, or so we can also, faculty rather, so we can also learn and course correct if we need to?
Yeah.
Just curious.
Yeah, I think that's a great idea. It is something that the group talked briefly about. The time frame, I think we still have to work out, you know, do you do something in the middle of everything or do you do something at the end of the semester? But I think this gives us a baseline of where people are. And then to your point, that additional data kind of helps us to understand how we progressed. Did we meet the expectations that people had? Was it better than perhaps they thought that experience was going to be? So I think that will be important. These pulse surveys, because literally this was about 20 questions, I think are to be really key to sort of gauge where people are sort of moving forward over the next several months. Yes.
Rhea, quick question. I'm struggling to understand. I'm a little confused. Maybe you explain this, but
sure.
So we did 2 surveys, one of faculty and then another one of faculty, but included staff in this one?
I really can't speak to the faculty one. We pushed this out and it included all faculty and staff. I think there was a separate decision made about doing something specific to faculty.
Okay.
Thanks, Rhea. Really appreciate it. Rhea's been just absolutely instrumental in keeping us moving through this. The last one we have for you today is among the most complicated, which is athletics and sports. We've got Forrest, Carl, and Tricia Bush. What's been among the most challenging aspects of athletics has been decisions we make cannot be done in isolation, because with athletics, we have conferences. And so decisions that are made by the NCAA directly influence us. Decisions made by the GLIAC, our Division II conference, and the WCHA, which is, of course, our Division I hockey conference, continues. If I had a nickel for every time someone asked me if we were playing football this fall, we'd solve all budget problems. I mean, it's just been absolutely amazing. Deeply appreciate the work that's really gone into this and the challenges with that. So let me turn this over to Forrest and then Tricia to talk about some of the issues. We could probably do 2 hours just on athletics and rec sport, but we'll keep this to a few minutes.
Thank you, President Erickson. As President Erickson said, Tricia and I are here representing the NMU Athletics COVID-19 Action Team. I'd like to thank the board for having us participate in today's update and for your continued leadership and vision for the university. I also want to thank the student athletes who have served on the NMU Athletics COVID-19 Action Team. And I'm going to mention them: Emily Miller from women's basketball, Joe Nardi from hockey, and Ellie Yako from the women's volleyball team. They've been meeting with us twice a week for the last few months and done a great job voicing the concerns of the student athletes. The 2 questions that I receive most often are, will we have competition this fall? And what will we do if student athletes test positive for COVID-19? So I'm going to break those down. First of all is regarding fall competition, where we stand today, and that changes every day. But last Friday, the GLIAC Council of Presidents decided on a conference-only regular season schedule. That means that practice start dates are delayed until August 31st and competition until late September. The logic being that this will allow more time to evaluate the situation. The presidents are scheduled to meet again on August 11th, and they will receive an update from the GLIAC COVID-19 task force, and they'll discuss fall sport competition and minimum standards of care that can be agreed upon for the conference. 2 days ago, there was a little bit of a breakthrough. The NCAA Division II Championships Committee recommended moving fall NCAA championships to the spring. This recommendation will be reviewed by the NCAA Division II Management Council tomorrow and the NCAA Division II Council of Presidents next Wednesday. We're fortunate that Northern Michigan University Faculty Athletics Representative Julie Rochester, who's the head of Northern's Athletic Training Education Program, is currently serving on the NCAA Division II Management Council, which is the second highest group in the NCAA for Division II. She's also serving on the NCAA Committee on Competitive Safeguards and Medical Aspects of Sports. So Julie's able to provide us with frequent health and safety updates from the NCAA Sports Science Institute. Our other conference, our hockey conference, the WCHA Board of Directors is meeting again tomorrow to discuss the status of each school's testing protocols, travel restrictions, and the status of their multi-sport conference. For example, 2 of the WCHA schools are members of the Great Northwest Athletic Conference, which has already made the decision to suspend all fall competition through November 30th. So we need to figure out how that impacts hockey. Regarding the other question of what will happen if student athletes test positive, we actually have our biggest group of student athletes that Northern's ever had this year. We're going to have 413 intercollegiate student athletes and 500 total varsity student athletes when we include alpine skiing, esports, and the national training site. So given this large number of student athletes, it's likely that there will be positive COVID-19 test results. Student athletes will be treated like all of their students on campus. Those living on campus who test positive will isolate in Spalding Hall, and those with close exposure will quarantine there. Off-campus student athletes will isolate or quarantine at their place of residence and be monitored by the health department. The specific question I get asked is about if there's a threshold of any sort when we would shut down activities. And the answer is no, there's not a predetermined threshold regarding a percentage of positive tests that would result in shutting things down. What we will do is follow guidance from Dr. Kirkpatrick along with other healthcare professionals in making that decision if necessary. What we've done to prevent or reduce the possibility of COVID infections, we've implemented many different operational changes. I'm just going to go through a quick list. Additions to our pre-participation physical exams. We're following a comprehensive guidance document from the NCAA that came out on July 23rd called the Resocialization of Collegiate Sport, Developing Standards for Practice and Competition. And that came with an associated checklist that we're using to guide us. Also for our national training site student athletes, we're going to be adjusting practice pursuant to small group training guidelines that have been put in place by USA Wrestling and USA Weightlifting. And also for our women's and men's swimming programs, we will follow USA Swimming guidelines for safe practices and reopening our facilities. We've also created a ticketing COVID-19 operating procedures document and an ice rental guidelines document to keep staff and patrons safe. And the other big event that we were planning for, the Marquette Marathon, after discussions with physicians and some of my fellow ski patrollers who provide emergency care for the Marquette Marathon, we decided to change that event to a virtual event this year. Next, we've also implemented many facility safety measures. I think you can see the slide here is a demonstration of that. This is an example from the Mariucci weight room, which has been modified significantly. Currently, we're limiting voluntary strength and conditioning activities to small groups of 10 student athletes. Student athletes who have received a negative baseline COVID-19 test and a pre-participation physical exam are having their temperature checked and review for symptoms with an athletic trainer before they enter the weight room. Student athletes enter the weight room with masks on and then remove the masks while they're working out. You can see the squares on the floor there. Those are 12-foot by 12-foot stations. There's also clear plastic. I don't know if you can see it in the pictures, but there's clear plastic sheeting between each station. The student athletes are bringing their own water bottles and they're wiping down equipment after each use, and the weight room is being thoroughly cleaned each evening. The same temperature and symptom check requirements are mandatory before entering the athletic training rooms. The Superior Dome athletic training room capacity has been reduced from 20 to 8, and every table is being cleaned immediately. I get a lot of questions about locker rooms. Locker rooms are not being used right now during this voluntary strength and conditioning activities time. we will make a decision on what type of locker room limitations to implement after the GLIAC Council of Presidents meet to discuss fall competition on August 11th. And then finally, the question about fans and attendance. This is one that we put a lot of thought and planning into, but it's going to depend on what requirements are in place. So, for example, if we have competition, the current rule in Michigan is that you can have 250 people in an indoor arena. Obviously, for football, a sport with 100 participants on each team, that's going to get used up by family members pretty quickly. If that limit was increased, but social distancing requirements remain in place, then we have to go through and look at each facility. And for example, the Barrie Event Center right now would be able to accommodate 380 people. If those social distancing requirements are changed, we would adjust to whatever requirements are in place and have additional discussions about how we prioritize students and season ticket holders and families of student athletes. So that's where things stand today, and they're changing quickly. We expect a lot to know a lot more next week. I guess before I turn it over to Tricia, are there any questions at all? No? Okay, with that, I'll turn it over to Tricia for an update on campus recreation. Thank you.
Good afternoon. I will be going through the modifications we have made in the PEEF Recreation Center first. The entrance looks a little bit different. We have utilized an intramural score clock in order to keep capacity counts, which are currently set at 50. However, we haven't fully reviewed the executive order that was released last night. So that's being reviewed by the university and they will give us the updated numbers later today. We have a plexiglass barrier. Sorry. There we go. We have a plexiglass barrier for our staff, as well as contactless entry as far as the scanner goes. Our concession stand is closed. We are keeping those extra windows closed on the side of the facility, and we will only be selling bottled water and Gatorade to patrons as needed. The spacing, as far as the machines go, we've spaced them out 6 foot to 10 foot, depending on what is mandated by the state. If there's a barrier between the machines, it's 6 foot. If there's not a barrier, it would be a 10-foot spacing at minimum. We have taped boxes around the benches in the free weight area so patrons can stay within that box while they're getting their free weights and using their workout. So it kind of gives them the visual so they don't just have to, you know, they tend to move the machines is what's the problem with our bench area. So we boxed it similar to the athletics area. So, and we put little signs that say, please do not move the bench. We've transformed one of our courts, as you can see in the photo over here on the right, into an additional workout space. So we were able to add 11 cardio-based machines, 7 rowers, 4 ellipticals, in addition to 4 benches, and also plyometric exercise spaces in that area. We've posted signage throughout the facility to guide patrons which stairwell to use, reminder that they must wipe down the machines after use. And as Cindy stated in the video, we are one of the areas using fun signage. We need some space. It's not you, it's the Rona. Because we do have over 5,000 students who are members in the P facility who like to work out. So we wanted to at least put a little bit of a smile on their face during this time. Our shared mats have been removed from the facility. Members are encouraged to bring their own. Racquetball courts do not allow for proper physical distancing. So those will be limited to 1 person or 1 family at a time. The fitness studio is available to be reserved, and that's a small space that we utilize the racquetball court, and that is a fitness studio that you can use and rent out for a private workout area for those that are concerned and don't want to work out around others. For the fall semester, we have added a weight room attendant position who will assist with enforcing face mask requirements, machine wipe policies, in addition to cleaning. We are continuing our curbside rental program for outdoor equipment of kayaks and stand-up paddle boards and fat tire bikes. We have been doing that since June, and it's been working great. In the locker rooms, we have closed the showers and the saunas. The day use lockers have all been locked, and only members who have purchased lockers will be able to utilize the locker space. The towel service has been discontinued until further notice. Signs for each row of lockers are in place to remind patrons of physical distancing guidelines. In the pool, facilities have added a shower head on deck. Since we closed the showers within the locker rooms, they will use the shower head on deck to rinse before and after swimming. We've modified the diving well and closed the diving board so that we have 4 lanes of lap swimming in the diving well, in addition to the 8 lanes that we have in our lap pool. So we are currently limiting the number of swimmers when we open in the next few weeks to 15 in the lap pool and 4 in the dive tank as a phase 1. Diving boards, oops, sorry. For the fall semester, we have also added an aquatic attendant student position who will assist with enforcing mask requirements on deck, physical distancing, cleaning kickboards after use, and monitoring time limits when patrons are waiting on deck. As far as changes in emergency care in the facility, our student building managers who are CPR certified will be using a hands-only method as suggested by the American Red Cross. We have purchased bag valve masks, BVMs, and lifeguards are already certified to use those. I would like to acknowledge the hard work and dedication of Katie Moe, who has helped with making all of these modifications and tracking the national guidelines. As far as the membership goes, we've extended those members who have had memberships with us during this closure 4 months. We will not be selling day passes or punch cards in order to keep with the capacity limitations that we have in place. The important piece for members to realize right now is that we need to remove the social aspect of the rec center in order to keep everyone safe. We are temporarily turning into a workout facility and not as much a recreation center. The Wildcat Fit Zone will remain closed until all COVID test results are back and the governor's order has been assessed. As far as community programs go, the first community program that will be held inside, at least at this time, in the P facility will be the return of the Wildcat Aquatic Club. It is a youth swim club, and we will be looking to start that with just 1 swimmer in a lane, so 12 swimmers at one time. Our senior swim and senior exercise programs through the HHP department have been approved to move forward with class caps. They normally offer about 100 seniors in their courses, and they are limited to now roughly around 35. We will also be continuing with youth swim lessons and American Red Cross certification courses with modifications following state guidelines. And then the big one that the community wanted to know is that tennis and pickleball courts will be opening up next week.
That's the second most. Yeah, when will tennis be back?
I knew it was coming. Do you have any questions regarding the rec center? Thank you.
Thanks so very much. I appreciate it. You know, as you know, we could go for another 2.5 hours on all the things that are going on. I mean, it's just been an amazing set of efforts on the part of the entire campus community. You know, I get asked the question just broadly, fairly regularly, you know, are we prepared and why are we prepared the way we are? And again, you know, I've talked to a lot of my colleagues around the state, and without naming names, I think there are too many places that their strategy is, we hope we don't have an outbreak. That's not our strategy. Our strategy is very much proactive in terms of what we're doing, how we're doing it, and how we're engaged. And I had a friend of mine from another institution ask me the other day, you know, what allows us to be as prepared as we are? And I've given this actually quite a bit of thought. And the answer is very much about the culture that we have here at NMU and the culture we have in the Upper Peninsula. You know, we very much have a culture of support, of supporting one another. All you have to do is drive around here in the winter and you can see what that culture of support is. People stop and help you out of a snowbank, help you dig out. It's just part of who we are. We also have this culture here of we are all in this together. Again, a very UP kind of culture. And I think it comes from the kind of environment that we live in. And so we've seen a lot of that. We have a culture of outreach. And we have, and you saw this in some of the data that came forward, you know, we have a culture that encourages people to bring ideas. It's not just, you know, we'll listen to you and you won't punish you if you bring us an idea. Our culture is, you got an idea, bring it forward and we'll look at it. And I tell you, Mike and Cindy have done a great job with those ideas. You know, all the things we've done have not been an idea from one person or one small group. It's come from a lot of different sources. And I guess the last thing I would say about it, what puts us in this position is we have a culture of community, and it is something that we value deeply. And so people are committed to what it is that we are doing. I'll just reiterate at the beginning of what I said. We are prepared. Are we worried? Listen, if anybody's not worried, that's probably a bigger problem. I expect, I know the folks behind me are like me, kind of wake up in the middle of the night worried about that next piece. It's good for us to be worried. We should be thinking about these things. And we will continue to work on it. We will continue to look for ways to make sure we're even better prepared. We will continue to work on being flexible and changing as we need to change. And with that, I'll turn it back to the chair for completing this.
All right, thanks very much. And again, a very comprehensive view on what we've been doing here at Northern Michigan University to prepare everybody for the upcoming school year. I certainly appreciate all the presentations that were made today, the time and the effort that has been going on really since back in January, February, when Mike and Cindy first began to monitor what was happening in Wuhan, China. And here we are all these months later, and I think as well prepared and probably much better prepared than other schools around the state or around the country. So congratulations to all involved. This has been terrific. We also do have one person who has a comment or a question. So feel free to go up that. And then Fritz, President Erickson has some questions as well.
Yeah, we did get a couple of online questions.
Online questions as well, and we'll have those after you speak. So.
Hi, thank you. My name is Emily Griffith. I am a graduate student and graduate assistant here at Northern. I'm also the biology student graduate representative, and I just wanted to address some concerns that we currently have. Sorry. First, I want to thank the university and all of the hard efforts that people have been doing to make sure that we have a safe return to campus. I understand that Northern has taken unprecedented amounts of time and effort to make sure that we do everything consciously and safely as we welcome our students and employees back to campus. But that being said, we still have concerns about some vulnerable individuals in our population. As you may be aware, a petition was submitted earlier this week to the board and other individuals regarding concerns that graduate students and instructors have for this upcoming semester. The primary concern that we have is that our current graduate assistantships and teaching assistantships do not have healthcare as other teaching contracts do. This has put a lot of students in kind of a tight spot. The $9,300 annual stipend that we get for our for our 20 hours a week a work on teaching does not leave students with a lot of room in terms of having a solid healthcare plan on their own. As the majority of at least students in the bio department will be teaching face-to-face in the fall, we are concerned as to what will happen if we get sick and cannot afford the healthcare to get better. Especially when we are teaching multiple times a week for up to 3 hours at a time in the close proximity with students. We understand that Northern is taking all of the efforts they can in order to reduce the risk of transmission, but that risk is still there. So the question that I have posing for the board today is, does the board object to providing health insurance to graduate employees during this healthcare crisis?
I'd be happy to answer that question. I did get a chance to look at the petition. I've been working closely with Lisa Eckert, Dean of the graduate programs, to explore what kinds of options are available. I know Lisa is putting together a response because there were multiple pieces to that. But let me directly address kind of our thinking around the health center, or I'm sorry, around the healthcare issues. One of the things that we're looking at is we have a lot of continuing faculty members. And what we do for those faculty members is we provide direct access to the health center. And should they have health insurance, of which many of them do, we bill that health insurance. And if they don't, we still allow them to use the health center. And it seems to me to be a fairly reasonable approach for us to provide that same opportunity to our graduate assistants. And so kind of look for that as Lisa's trying to finalize all the details with that. We are very concerned about our graduate assistants. They play a very important role on this campus. It seems like being able to use the health center and having direct access to Dr. Kirkpatrick and being able to provide that, I think is a reasonable approach. So kind of watch for that.
Thank you. Do you know when we should expect a formal response?
Well, I know the request was by August 3rd, so I suspect you'll get something by August 3rd.
Great. Thank you very much. I don't have any further questions.
Thank you.
All right, thank you very much. Appreciate that. Understand.
Thank you.
The North Wind has 2 questions.
Hello, my name is Justin Van Hoff. I'm the editor-in-chief for the North Wind. I came here today to bring to the attention of the board of directors concerns that students are having, concerns about the way this has been handled, concerns about communication, and concerns about keeping students in the loop. Many students I've talked to never even received an email or any sort of communication telling them there was an active COVID case on campus. That didn't happen. A lot of friends reached out to me telling me that they never even gotten an email letting them know there was somebody who even tested positive. That's not acceptable. This is not about just political things. This is safety. These are our lives. You know, we talk about, those students, 60 student workers who are working here. I was one of them. I was one of these workers who came in every day. I have underlying health issues. I have underlying risks, which is why I work with disability services to fix that. But there are so many students who are not even giving the option. I understand you guys are asking each other, hey, are we going to have the option to teach classes, but are we going to give students the option to pick between whether they want in-person classes? That is the question I raised to the board.
I'd be happy to
Rich?
take a shot at that.
Yes.
Justin, I'm happy to sit down with you and kind of go through any number of questions that you have. But the option is, we have a very detailed process in which to do that. And I've received this kind of question from me, and we've provided a number of different ways. But the option is that you simply make a request for an accommodation through disability services. And we've had any number of students that have made that request, and that request has been granted. So in your personal situation, if you have underlying health conditions, it's a very simple thing to do to make the request for the accommodation. All of our faculty are well aware and have accommodations set up for their classes so that our students can not only be accommodated, but continue forward positively with their education.
Yes, I understand that process very well, considering I have just completed it.
Oh, good.
Yeah, perfect. But the issue that I'm raising here is why weren't students looped into this? Why didn't we know there was a COVID case of anybody on campus?
Well,
why was there mixed communication there?
Yeah, we provided an announcement to the whole campus community, everyone who's a student right now and all set. So I'll be happy to look into that and kind of figure out why, but we made the broad announcement.
Okay.
Mike?
Thank you.
So Justin, to answer your question, by the Clery Act, we have to post it to the current student list, the summer students, which did not include some students that are enrolled for the fall who may have been here for the summer. Okay. So it went out to those that were enrolled in summer, is about 2,100, and then all the employees that are on that list. In another week, if we have another one, when that email goes out, it'll hit the fall group. So it was a timing thing based on what we're by federal law, who we have to notify. And then we used our other communication tools to get it out also. Okay, did that answer your question? Good.
Thanks very much, Mike. And Fritz, you have some other questions?
Yeah, we did receive a couple of online questions I thought I could respond to. First, is the COVID test required for students to come back for our campus? Many of us are unsure if it's absolutely necessary or if this is a strong recommendation for returning. The starting process for the passport to campus is get tested. You can't complete all the other things until you get tested. So the simple answer is yes. We expect and require everybody get tested unless you have an approved medical excuse. That baseline testing is really important. And so that is that requirement. The second one is, in light of the new executive order limiting indoor in-person meetings, a statement that we believe classes are exempt from the indoor maximum. Can you explain how you're valuing student health over the wealth that they provide the university tuition and fees? I'll talk to Emma. This came from Emma Drever. The simple fact is we are not and would never place our student health over this sort of elusive concept of wealth. We have a lot of students that are really interested in making sure that they can continue their education and graduate. And I really thank her for the inquiry. I really do hope we've answered many of the questions during today's presentation. But remember this, Northern is taking all reasonable and prudent steps to protect the health of our students, including following federal and state COVID-related guidelines on campus testing. We want everybody to be tested, health monitoring, workplace, classroom safety evaluations and renovations, everything we've done around student transportation, accommodation issues, revised attendance policies, housing accommodations, setting up opportunities for isolation and quarantining the rooms. The reference to the exemption of the indoor maximum only refers to restrictions in Executive Order 2160, which came out last night, which addresses social gatherings, not in-person teaching at educational institutions. And I think that's an important thing to remember, that Executive Order 2020 does not apply to Northern Michigan University, or as educational institutions are required, which we have done, to formulate safety plans, which again we have done or are completing different aspects of. Very much appreciate the question. And finally, what is the plan for classes if and when a professor contacts the virus and is unable to teach? It's really the same set of plans that if a faculty member will become ill for any reason, and that is to work with the department heads that make those accommodations, either by bringing someone else in to teach the class or being able to provide different kinds of learning opportunities. So we see that as really falling under the same guideline. So those were the questions I received that way. Are there any other questions from the board or anybody else?
Seeing none, then a motion to adjourn this formal meeting of the Board of Trustees.
So moved. Support.
And we are adjourned at